Hi, how are you all doing? Hey, people are still joining in. Let them join. Akhil will also join. How are you all doing? Why everybody so silent? Like all are stressed, kya? No one is talking to me. Everyone will only talk to Akhil.
Hello, ma'am. Good evening.
Hi, Namit. Good evening.
I'm here.
Finally, somebody is interested in talking to me.
मैम एक्चुअली व्हाट हैपेंड वाज अभी जस्ट जो है आपने देखा हो तो मतलब उन्होंने नोटिस निकाला है ने, तो उसमें दे हैव मेंशन्ड कि ट्रांसपेरेंसी रहेगा जो भी आंसर क्या आने वाला है, तो एवरीबॉडी आई गेस टेंस्ड कि क्या होने वाला है क्या नहीं होने वाला।
आपके ही लिखे आंसर्स हैं। अब रिजल्ट में जब डर नहीं लग रहा है तब आंसर देख के क्या डर लगेगा, बताओ।
नहीं, वी नेवर नो ना कि क्या हो सकता है क्या नहीं, बिकॉज दे माइट चेंज द आंसर्स एंड फिर रिजल्ट भी चेंज हो सकता है, पीपल माइट चेंज, मतलब जो भी है स्टे तो लगने वाला है ऐसा फील हो रहा है मैम, पता नहीं तो मे बी।
ठीक है, जो होगा देख लेंगे। हमें आदत हो गई है नीट पीजी में कुछ भी होता रहता है, तो
इसलिए फिर
whatever
मैम
will
ये
happen will happen.
इसलिए फिर मैम मेन फोकस अब यही है कि अब जो भी है 2 मंथ्स मिले हैं तो आईएनआई पे अच्छा से फोकस कर लेते हैं।
For sure, for sure. मतलब देख, इस पूरी जर्नी में जो होता रहेगा वो तो होगा ही। लाइक इफ काउंसलिंग हैज टू हैपन, वो होगा अपने स्पीड पे। हमारे कितने भी स्ट्रेस लेने से काउंसलिंग इतनी स्पीड अप भी नहीं हो जाएगी। सो every processes will take time, and मेरे को लगता है the best to keep our mental sanity in check right now is to prepare for INI, because at least उतने देर में मैं पढ़ती रहूंगी तो I would have some hope to survive all this uncertainty. If I would have been at your place, I would have set for INI, but unfortunately मैं तो पूरी इस रेस से ही बाहर हूँ. I'm an engineer.
अच्छा, यू आर एन इंजीनियर, वाओ। सो ये मैम, ये दिस इज जस्ट पार्ट टाइम साइड जॉब which you are doing?
Oh, no. It's my full-time work. I have founded Salaah Shots. I have left my
Okay.
job in last year August and working and building this space for all of you.
Oh, amazing, ma'am. Many of us aspirants are
Ma'am,
very
you're
confused.
actually so inspiring, ma'am. Even in the morning, I was talking to you. You're like so positive. Uh, Talking to you itself gave me so much positive energy to read for INI and sit for this exam. Thank you so much, ma'am. I'm so.
You're welcome.
It's so nice talking to you. It's so positive. I got so much positive vibe while talking to you. You're so much like Sakshi Arora ma'am from OBG. She says, Bachcho, hi Bachcho. You're like, okay, Bacha, you can tell me whatever you want. You have any problem, you can tell me like that. That's so sweet of you, ma'am.
Thank you. Because I genuinely believe it. See, no exam will ever decide that how talented you are and what your future holds. Because I myself have seen a lot of setbacks in life, but if now when I look back into the in hindsight, everything makes sense that if that happened for a reason. Everybody, all of us have a different story to write in this world. And with us, it's just completing that story. So have that faith in life and keep giving your best. You don't know what story is getting written for you. Just keep giving your best.
True,
That's
ma'am.
it. That's in our control. So you all are such a talented people. Trust yourself. You already have been to this
But
medical
what
journey.
I observed is like there are just some lacuna we have to fill in these in between NEET and INI. That's actually when I sit back and retrospectively look at my mistakes that I've done. It's either one chapter that is pending that I left or that I read superficially without going deep into it, or leaving that particular topic in my revision cycles. Everyone have that particular mistake that we have to correct and we have to move on, in my opinion.
Right. And if adding to this Namit's point now, if the answer sheet will come into the picture, you will have a very clear picture that which question you have made mistake on. We might have been thinking that I've made it correct or not. But if we'll just look back to your answer, you're able to get a clear picture that which subject I messed up and why have I messed up. Was it that I was not prepared enough to handle the uncertainty, or I was so anxious that I've ended up making all the mistake? You'll have more visibility and honesty with yourself looking at the answer keys.
True,
If
ma'am. True.
so, just utilize it to your fullest. And I think you already have studied so much till now. It's just that 2 mahine you have to give, just sharpen it wherever you are just making mistake, figure it out and just sharpen it and go for INI.
Yes,
I
ma'am.
think
True.
Akhil,
Very true.
Akhil, have you joined the session? Else I
Yeah,
have to
yeah,
put
yeah.
on apology.
I have joined
Oh,
the
hi,
session.
Akhil. Your camera was off. How are you doing?
Am I visible and audible?
Yes, yes, you are both.
Okay, thank you, thank you.
Everybody's eagerly waiting for Akhil sir to come and take the session. So, because Akhil sir have
All
done that wonder,
from
right?
all the
NEET
people.
PG ke baad, yes. NEET PG ke baad suddenly has made that jump of All India rank 6 in INI November. So he had understand that what it takes, and he will be better able to guide you, all of you. So I'll not take much of your time. For all of you who have joined it for the very first time, I'll just quickly introduce myself and the whole process, how you have to take it up. So I'm Astha, co-founder of Salaah Shots. And Salaah Shot, we are trying to build a space that every medical aspirant or a doctor can get a space to talk to one another. No more isolation, sitting in a space and you have nobody accessible to. Now you have your peer accessible, and every senior and topper of any particular exam, you can access them. That is the space, safest space we are trying to create for all of you. And regarding this webinar, how we will take it, that first Akhil will present whatever information he has to pass on. And meanwhile, you all can keep dropping the questions in the chat box here. And don't mute yourself and ask question that particular time. Let him finish. And once that will be done, we can pick your questions from the chat box, or either you can unmute and ask yourself, so that everybody can get a chance to let their question get answered. Okay, Akhil, over to you.
Hello, hi everyone. So I will be sharing my screen first so that I hope my screen is visible to everyone.
Yes, it is.
So hello, hi everyone. How are you all doing after NEET PG? And I was hoping that this week only results come, because as soon as the results come, it's better that the results of NEET PG comes earlier, so that you have the better understanding, better idea now what to do further, what to go ahead. And it happened last year also that between NEET PG and ANI there was this much time only, and the NEET PG counselings got delayed and all those things. So honestly, I had got a decent rank in NEET PG, and I was not preparing for INI. In my mind there was nothing about INI, because I thought ki NEET PG counseling will be earlier and then I will be busy in that, and till then the INI will be over. So our first NEET PG counseling was scheduled in September only, but then it got postponed and postponed and postponed. and that's what gave me time. Okay, I have time, I can do better, because I spent like 2 to 3 weeks after NEET PG, matlab in entire masti mode and all. I visited places, I went for a trip, and I did all the things. So I was like कि ठीक है, अभी NEET PG काउंसलिंग अगर डिले हो भी गया तो अब अपने पास टाइम है. I have done all the things, and with doing all the things, like I went to gym also for 1 hour, I played for 1 hour. So even if you spend 3 to 4 hours a day in your co-curricular activities or whatever you want, then also you can easily spend 10 hours, 8 to 10 hours per day for INICET November. So that will give you both a kind of satisfaction that yes, I am doing what I want. Like if you want to play, or if someone wants to listen to music, someone wants to watch some movie or thing, you will be able to do that thing also, and you will be able to study also. So that combination is a very, very good combination. So believe me, मतलब that was the thing that I was studying just like flawlessly. मतलब कि ठीक है, आज मेरा मन किया, मैंने जितनी भी देर मन से पढ़ा, अपना पढ़ा, विदाउट एनी स्ट्रेस, विदाउट एनी काइंड ऑफ टेंशन, तो एकदम स्मूथली सारी चीजें हो गई. एंड मतलब इट विल नॉट फील लाइक कि देयर इज अ बर्डन और थिंग. So just in these, especially in initial this month till August, just do things whatever you like and all, and then you can slowly and gradually, increase your hours from 6 to 8 to 10 to 12. So that process, if you will follow, then that will be a good thing. If now you will think that I will study like 14 hours, 15 hours, so it's still there are, yes, there is less time. But if you have studied for NEET PG, then you can start with 6 to 8 hours, then increase it to 10 or 12 hours. Okay. So the thing basically is that NEET PG result is over, and that will not define your destiny or anything. Okay. And your next effort towards INICET in November will count. Definitely that will count, because giving INICET in November has advantages. In May INI, many people have already passed by. Okay. And in NEET PG also, many people will pass by, and many will think that okay, they have got decent rank and they will be satisfied by their NEET PG rank, and they will not prepare for INICET November. So INICET November gives you a lot of chance, matlab a lot of chance in terms of getting a very good rank and getting into the central institute. And in May INI and November INI, seats are approximately same. In fact, in November INI, the seats are more as compared to May INI. So that is also an added advantage. And the juniors is not excluding AIIMS juniors, the rest of the whole nation juniors will not be able to give INI. Okay. So it will be advantage for you that you give this INI. So if you have something regarding Central Institute or anything, then please appear for it. Okay. So after NEET PG, if you have got a great rank, okay, and you know that you will get your desired rank and desired college, you will get desired branch, you will get. So you don't want to do anything in your life and just want to spend these 2 to 2.5 months in like full masti mode and all. So just do that. Okay. No one is stopping you, because that is also life. Okay. Exam is just a part of life. If you will spend your entire time in just studying an exam, then you will be in residency. It will be a lot of hectic things going on. Then you will be quite burdened and all कि मैंने फालतू इसके लिए भी पढ़ा, ये पढ़ा. तो अगर बहुत ही अच्छा रैंक आए तो यू कैन डू दैट. बट अगर बहुत अच्छा रैंक आया और एक महीना भी मजे कर लिए, उसके बाद अगर आपको लगता है कि यस, now I can do some things, I can start preparing for INI and do these things, so you can then also start. Okay, because you have studied well, you have revised well, you have studied well, that's why you have got a great rank in NEET PG. So now even if you put little efforts, okay, and in entire day if you don't do anything, then also it feels like boredom. So if you will study something and do things like that, so you will also enjoy studying. And by the time INI November will come, NEET PG counseling will not be over, and you will be easily able to give a good INI November. Okay. And then if you have got a mediocre rank, okay, so in mediocre rank case, you will compromise either the college or the branch, है ना? And you have got a far off rank that you will not get any branch or any college. So for these two people, though, INICET is the second chance, or you can say the golden chance. Okay, you have to consider INI. There is no option not considering INI and just thinking about the next PG कि अभी इस साल तो नीट में नहीं हुआ, अगले साल सिर्फ नीट पीजी सोचेंगे, अभी नवंबर वगैरह के लिए नहीं सोचेंगे. Just don't think like that. You have to. It is your chance, and in INICET November, there are much more higher chances than INI, because next INI again your juniors will also compete with you. Okay, so keep that thing also in your mind. Now if you have got a great rank, not a great or decent rank like I got, so it will be a bonus exam without any stress. So just just solve some questions for fun, just to teach your junior who is preparing, just teach your friend who is preparing for next NEET. If you have got a good rank, then also you can easily clear INI November. So now the question comes, see, knowing why you should give INI is also very important, because if you will have that thing in mind, you will constantly work for it every day. Each and every day you will work for it, because if you don't have कि क्यों ही करना है, क्या ही करना है, क्या ही होगा सेंट्रल इंस्टीट्यूट में जाकर, क्या ही होगा, अगर if you will have that mentality, तो फिर आप उसके लिए अच्छे से प्रिपेयर भी नहीं कर पाओगे, ठीक है. So in these 7 months, 7-8 months, what I have observed, I will tell you that. So you will learn all the standard protocols for diagnosis as well as treatment. Okay, in a central institute, the things go in a proper manner, almost like the things that will go in the private institutes. Okay, and even sometimes better than that. And so there is a proper standard protocol, proper standard things for the patient that is actually required in your future practice. Okay, you will have all the resources available, है ना, जो भी आपको standard care के लिए, what all you read in your textbooks and what all you read in your articles, that will be available. So you will be able to apply those things, and that will be very, very helpful for your future practice also. And you will have a very broad spectrum cases, because in central institutes, all the rare cases, okay, all the complicated cases, they all come in the central institute, and you will have a very good idea about the cases variety. You will see all those things, and definitely you will be a better clinician, especially if you want to take medicinal branches, okay, like radiology, medicine, derma, all these branches. If you want to take, then central institute is preferred. In surgical branches, yes, it is almost the same, or you can say state colleges are better, because you will get more hands-on there. But in medicinal branches, definitely central institutes are the best. So if you are aiming for that, then you should appear for that. Okay. And another thing is that academics, it's better. In state colleges, there will be no classes, no seminars kind of thing, no conferences, very less if there will be there. But here you will have regular classes and all, and you will have seminars. You will have your co-PGs who are, into academics, who are doing different conferences, who are going for different things. So that will also motivate you and inspire you to do those things. Okay. And facilities and equipments, especially in branch like radiology or nuclear medicine. Okay, so you have to have that equipment, otherwise you will not learn the advanced technologies, and you will be already left behind. Okay, all the advanced CT machines, MRI machines, or all the advanced things. If you have IR set up in your institute, okay, interventional radiology, if you want to take radiology, then that is booming. If you have all the super specialty branches in your institute, then obviously that is an added bonus. Okay, in medicine also, there are postings in cardiology, neurology, and all. So you will have all the ideas on in that perspective. So definitely you have to go for that, है ना? And campus facilities, you will enjoy the campus. The campuses of all the central institutes are great. Stipend is better, and obviously you will have brand value. Okay, so you should keep these things in the back of your mind, because 2.5 months are there. Last 15 days में तो क्या होता है, सभी पढ़ लेते हैं, है ना? Last 15 days में, last एक month में सब पढ़ लेते हैं. बट लास्ट अभी 2.5 महीना है, ठीक है. इट्स नॉट अ लेस टाइम, ठीक है. अगर आप रोज अभी 10 घंटे भी पढ़ दो, देन यू कैन स्टडी, मतलब मोर, वेरी वेरी मोर, ठीक है. सो these things you have to have in your mind, so that it keeps you constant in these 2.5 months, na? So that is what will matter. The consistency in these 2.5 months will matter. It will not matter ki one day you studied for 12 hours and then a whole week you spend like anything, you have wasted the whole week. So that will not work. Study constantly, that is the most essential thing, because there are facts, there are concepts, and you will forget them as the time passes by. Okay, so I have forgotten so many things that I have studied in PG now, because the time has passed, so many months have passed. So धीरे धीरे चीजें भूलने लगती हैं, ठीक है. तो इसलिए जरूरी है constantly daily you have to revise certain things, है ना. तो अब why अपना आंसर हो गया. Now we will move ahead to how, ठीक है. अब how to proceed ahead now. So why should be clear to all of you. You have all joined the session. That means you want to appear for November INI in a very good manner. Okay, so keep these things in mind, and now I will tell you how to proceed ahead. Okay, so first group of students who have not completed the subjects at all. Okay, so if you have not completed the subjects at all, then if you have some subjects left or some topics left in a particular subject, then you have to complete that, and you don't have to give now entirely separate time for that. If you have completed till now, then it is fine. But now on, make your schedule, and in between your schedule, like suppose if you're studying a particular subject, then in the evening 2 to 3 hours or 4 hours, plan the topics, plan the subjects that are left. Okay, so plan them at the end of the day, है ना. तो एंड ऑफ द डे पे और उनको प्लान करो, ताकि सुबह सुबह आपने जो प्लान किया है वो आपका कवर हो जाएगा एक बार. सो यू विल हैव कॉन्फिडेंस, यू विल फील बेटर, एंड देन जो भी आपका बचा हुआ है फिर वो आप उसको बैकलॉग में कवर कर लो. डोंट थिंक कि मेरा इतना सारा बचा है वो बचा है. अभी 2.5 महीने के अंदर आप शेड्यूल के अंदर अगर रोज 2-2, 3-3 घंटे भी इनकॉर्पोरेट कर लोगे, देन यू विल बी एट पार्ट टू दोज पीपल who have entirely completed their subject for NEET PG. Okay, so don't feel that you are left behind or anything, and make your schedule in a manner that so that at least you have time for 2 revisions. Okay, because that will be beneficial. In the INI there is less time relative to NEET PG, there is less time. Okay, 45 minutes, 50 questions. So definitely your recall speed, your recall capability should be very much, है ना. तो उसके लिए आपको रिविजन जो है वो तो लगेगा, है ना. तो इसलिए एटलीस्ट 2 revisions you should plan. Now talking about, you have completed once the subjects, you gave NEET PG, but definitely you didn't revise well, that's why you have not got a good rank, है ना. So in that case what you have to do, you have to revise once according, like if you have any schedule of your own or you are following any schedule, that's fine, whether you are following BTR schedule or any other schedule that you have made yourself. Okay, so if you are following that, then that's fine, है ना. तो सबसे पहले जब भी आप चालू करो कोई भी सब्जेक्ट है, सपोज 3 दिन या 4 दिन अभी मेरे को फिर बायोकेमिस्ट्री करनी है, या फिर 5 दिन 6 दिन सर्जरी या फिर ऑब्स गायनी के अंदर लगेंगे, तो जो भी आपका प्लान है, ठीक है, उसके अकॉर्डिंग आप पूरा अपना जो भी रिविजन है वो आप सबसे पहले जो भी नोट्स बने हुए आपके जिससे भी आपने किया है अभी चेंज नहीं करना, ठीक है. अभी आपने जिससे भी एक बार नीट पीजी के लिए कंप्लीट किया था, either they were main notes, either they were rapid revision from Marrow or any other platform, or BTR you did, you have to keep that as your core now. Okay, and now you will have to build on that the entire 2.5 months. Okay, so now revise once, है ना, just open your notes, just revise once quickly. It should not be like you are memorizing each and everything, each and every page you are taking 5 minutes, 10 minutes. Matlab, don't do that. Just take 2 to 3 minutes for every page, and because you have just completed the syllabus, just take 2 to 3 minutes for every page and just finish off the topic or whichever subject you are studying. Suppose you are studying biochemistry, so just finish carbohydrates quickly. And then what you should do, you should now go to my Telegram channel, and if you have completed and revised for NEET PG, then both the strategies are same only. So if you have completed your syllabus and also revised for NEET PG, then you have to directly go to my Telegram channel, and I have already made the topic wise PYQs of all AIIMS and NEET hashtags. So you just go there and you just pick the topics that you have just studied now, है ना, जो भी आपका schedule के अंदर topic है उसको solve करो and just annotate your notes then and there. So what you have to do, like you solve, suppose there is topic of carbohydrates and you have approximately 70-80 questions from that. Okay, so if there are so many questions from that, then just solve those questions in the morning, and then you have to, if you have completed and revised, then you have to just do retrogradely. First solve the questions and then you have to annotate your notes. If you have not revised, then just revise your notes once, then solve the questions and then annotate your notes. Because this annotation na, this matlab this is what is the most important part of your preparation. Like last 10-15 दिन के अंदर यही annotated चीजें, यही जो flash cards आप बनाओगे, these will be your bonus things or these will be your go to things कि हाँ आपको that will give you a sense of completion. Because never you will be able to revise the entire things or the entire notes, even if it is BTR or RR, you will not be able to revise in the last 10 to 12 days. And I have seen so many people who have said that कि सर हमने पढ़ा तो था but we were not able to do. और अभी recently मेरे juniors और जो भी है जिसको भी मैंने ये सब बताया था, they did perform excellently well in this NEET PG also and in May INI also. Okay, from my own college there were many juniors who performed brilliantly. So they followed this, and now when they called me and said that ki sir we followed what you told and that worked for us, and that matlab there was no stress, we just followed it blindly and we were able to get par. So that these things will give you a sense like you will not have to worry anything, or you will not have to think what I have to do now, how I have to do. So that all things I will clear you in this webinar only. Okay. So now what you have to do, you have to annotate your notes, just highlight the notes. Okay. And just mark AIIMS or NEET, or just use color codes like yellow for AIIMS or green for NEET. So just highlight those points. And in a particular question, if you have a particular thing that you are getting wrong, don't highlight the entire topic, just highlight that particular keyword. Keywords is the master for the last revisions. Okay, so you have to just highlight those keywords. Like, you remember there are 4 things in a topic, you remember 3 things, you forgot the investigation of choice, or you forgot a particular clinical feature that is a diagnostic thing for a disease, or you forgot the particular drug that is there. Okay, or the mechanism of action for that drug. So you just have to highlight those things in your notes, and not the entire things, because that will again make your notes cumbersome. Okay, we are just aiming to trim down our revisions when we revise further in the second revision, so that we are very confident on the areas that went wrong in our earlier revision. The things that you are doing right now, okay, you will do definitely right them, मतलब 99% चांसेस हैं कि आप उसको सही करोगे, है ना, और जो आपने चीज गलत करी 90% चांसेस है कि आप उसको वापस गलत करोगे. So that's how the thing goes. You have to work on the weak areas, you have to work on your weak topics. That is very important, है ना. अब आपने एनोटेट कर लिए नोट्स, अब एनोटेट करने के बाद भी आपको लग रहा है नहीं यार ये पीवाईक्यू तो अभी एनोटेट तो कर लिया, बट एनोटेटेड पार्ट भी मैं कब देखूंगा, जब मेरी ये रिवीजन साइकिल कंप्लीट हो जाएगी, या फिर बीच में कभी ऐसा टाइम आएगा महीने 2 महीने बाद, तब जाकर मैं ये एनोटेट नोट्स देख पाऊंगा. तो आपको ऐसा लग रहा है नहीं ये तो मेरे को अभी चीज बार बार रिवाइज करनी पड़ेगी, ये तो मेरे को बिल्कुल भी याद ही नहीं हुआ, तो जस्ट उसका क्या बना लेना है, छोटा सा फ्लैश कार्ड बना लेना है ना. ये मैंने मेरे यूट्यूब पे वीडियो में भी बता रखा है, और पहले भी मैंने टेलीग्राम चैनल पे भी बता रखा है. दिस स्ट्रैटेजी विल हेल्प यू अलॉट. आपको जिस भी टॉपिक में कुछ भी हल्की सी दिक्कत है, जो भी पर्टिकुलर चीज की दिक्कत है, इन्वेस्टिगेशन ऑफ चॉइस भूले हो किसी का, किसी ड्रग का कुछ ड्यूरेशन भूले हो, या फिर किसी डिजीज का कुछ पर्टिकुलर थिंग भूले हो कि इसका डायग्नोस्टिक क्राइटेरिया क्या है, या फिर जो भी क्रैमिंग वाले थिंग्स है, उनको जस्ट राइट दोज थिंग्स ऑन अ फ्लैश कार्ड एज एंड व्हेन यू सॉल्व दैट क्वेश्चन. ठीक है, साथ ही साथ करना है. आप सोचोगे कि मैं रात को बैठ के और जो भी आज पूरा करा है वो पूरा की पूरा बैठ के रिवाइज कर लूंगा. दैट नेवर हैपेंस. मैंने इतनी बार सोचा है कि आज की सारी मिस्टेक्स करते हैं, फिर याद ही नहीं आता क्या क्या करा था, और फिर उसके बाद चलो छोड़ो, और फिर उसके बाद वी गो टू स्लीप. ठीक है, तो इसलिए साथ ही साथ अपने को फ्लैश कार्ड या फिर वो बना लेना है, बिकॉज दैट इज द ओनली थिंग दैट आई रिवाइज्ड while going to bed, nothing else. ठीक है, and that takes only 10 to 15 minutes, and I have no burden कि क्या अरे यार आज इतना सारा करा था. ठीक है, जो भी करा था उसका ये लास्ट में मैंने 20-30 पॉइंट्स हैं, आज पूरे दिन के सिर्फ इतने ही पॉइंट्स हैं जो कि मेरे को आज रिवाइज करने हैं, तो मैंने उनको लिख लिया एकदम शॉर्ट फॉर्म के अंदर, और मैंने उनको सोने से पहले रिवाइज कर लिया. अब आपने जब इस प्रोसेस से पूरा सब्जेक्ट करा, आपने पहले उसके नोट्स पढ़े, ठीक है, और आपने पहले से पढ़ रखे तो क्वेश्चंस डायरेक्टली करे टॉपिक वाइज, उसके बाद टॉपिक वाइज क्वेश्चंस करके आपने वो पूरा सब्जेक्ट कंप्लीट करा. अब पूरा सब्जेक्ट कंप्लीट करने के बाद you go to a SWT or you go to a TND, any TND you can give, okay, BTR or any other TND, DAMS TND, Bhatia TND, all TNDs are good, and faculties have made TND in a manner that they are asking those particular PYQs that have the high chances of asking. Okay, so you have to solve those things and then you have to analyze. ठीक है, अभी मैंने जो भी टॉपिक्स करे, जो भी मैंने PYQs करे थे, जो मेरे नोट्स हैं, अब जब आप टेस्ट दोगे देन यू विल हैव द बेटर एनालिसिस कि नोट्स में कितना कंटेंट है, क्या उसमें कितना ऐड करना जरूरी है, क्या मेरे ही रिकॉल के अंदर दिक्कत है, ठीक है, कहीं ये तो नहीं मेरे को ही चीजें याद नहीं हो रही है, मेरे रिकॉल में क्या दिक्कत है, कोई पर्टिकुलर टॉपिक जो मेरे को बार बार विच इज अगेन एंड अगेन इरिटेटिंग मी कि यार ये मेरे को हर बार ही गलत हो रहा है, बार बार ही गलत हो रहा है, बार बार ही गलत हो रहा है. सो दोज थिंग्स यू विल हैव आफ्टर गिविंग द टेस्ट. ठीक है, टेस्ट से पहले जब तक अपन करते हैं तब तक अपने को ये लगता है कि हाँ सब आता है, मुझे सब आता है, बट व्हेन यू गिव टेस्ट यू विल एक्चुअली रियलाइज. ठीक है, एक्चुअल रियलाइजेशन होता है कि यार ये तो मैंने सोचा था आता है, बट ये तो मेरे को अभी अच्छे से नहीं आता. Even if you have revised well for NEET PG and you will give test now, you will commit so many errors and you will think, oh भाई अभी भी मेरे से इतनी सारी गलतियां हो रही है even after revision. ठीक है, so that will happen, और उन्हीं एरियाज पर अपने को काम करना है. ठीक है, तो सिंपल है, आप मेरे टेलीग्राम चैनल के ऊपर जाओ, है ना, उसके अंदर मैंने अलग अलग सेक्शंस बना रखे हैं. ठीक है, तो सेक्शन है फ्लैश कार्ड का, कस्टम मॉड्यूल्स, PYQ MCQ प्रैक्टिस एंड इंपॉर्टेंट PYQs. तो जो अपने कस्टम मॉड्यूल वाला है ये टॉपिक वाइज. ठीक है, इसके अंदर आपको जाना है, जस्ट सर्च द सब्जेक्ट.
Akhil, sorry to stop in between. Couple of people are asking for English. Let's
okay.
I know that that's first language for me too. I just become so comfortable talking, but yeah, for
Yeah.
some it's
Actually, yes, that's the thing. I am able to better express in Hindi. So I'm just mixing it. Okay. So please interrupt me if you are not able to understand anything. Okay. I will repeat that thing in English also. So you have to just go to my Telegram channel and open the custom module, okay, which is topic wise. Then you have to search the subject name or the topic that you want to solve the questions of, and you will get the PYQs of the same. Okay. You will get the PYQs of each subject, and you will get also the approach how to do. Matlab, I have made a short summary ki, in this manner you can complete your subject in the fastest or the quickest manner. So I have also written that along with the PYQs. I have written also just below that there is a message which gives you the information how you can complete the subject in the best possible manner for this much duration of time. Okay. So that will happen, and I will also post now regularly the content or the PYQs, and just I will just mark those things that you have to do, and I will be following a schedule. I will probably follow the BTR schedule only because many people are following that, and ma'am has made schedule in a nice manner only. So you can follow any schedule, and I have already made all the things, all the topics in that. So you, if you are following different schedule, then you can just search in that Telegram channel, and you will find all the questions regarding that. And I have made some flashcards also, so I post that, and you can just use them as a reference key. Okay, how to make a flashcard from this particular thing or like that. So you can have a better idea key how can I make my flashcards, my own flashcards, because when you write from your own in a simplified manner, not just someone is teaching and you have written like we write in class notes. I don't think that making, like we talk about handwritten notes na, so handwritten notes में सामने वाला कुछ बोल रहा है वो अपनी language, he is explaining in his language, and you write that and you think that I have made handwritten notes and I will remember better, but that's not the thing. If you have printed notes, you have PDFs, you have to understand that, you have to then write with, matlab, you don't have to see that and write, you have to write on yourself, है ना? Just memorize it, and you in your brain just form a flow chart or something and then write, then only you will remember better, because that person who is teaching, he has made it in his mind the flow chart the way he remembers. Now you have to modify that according to you. Okay. So you might simplify the things even much more. Like I, when I used to write, I also thought कि यार ये तो already simplified है. But when I wrote it down कि हाँ यार इसमें तो और भी इतना ज़्यादा simplification हो सकता है. So much simplification can be done if I use this thing, or I will be able to remember this thing in this particular fashion. So just write that. Okay. So that will give you a better analysis or better when you will revise further. Na, that will, you will study that, and the same flowchart will be formed, because that you have formed with your brain, and you have made efforts in forming that, so you will remember that for a longer time. Okay. So, and in the important PYQ section, I have made some PDFs that highlights the common mistakes that we tend to do in PYQs. Okay. So all these are available for free only on my Telegram channel. And regarding INI, so obviously all of us know that INI focuses on concepts, and concepts are there in subjects, मतलब especially long subjects like pharmacology, pathology, micro, ठीक है, बायोकेमिस्ट्री, एनाटॉमी, तो ये सारे फर्स्ट और सेकंड प्रॉफ का हो गया है ना, ये सारे के सारे इंपॉर्टेंट है, साथ में ऑब्स एंड गाइनी हो गया, सर्जरी हो गया, पीडियाट्रिक्स हो गया, ठीक है, फाइनल ईयर से ये तीन, तो थर्ड ईयर से इतना नहीं आएगा, ठीक है, थर्ड ईयर से इतना ज्यादा कुछ नहीं आएगा, फर्स्ट और सेकंड प्रॉफ का हो गया, फाइनल प्रॉफ में जो मेजर सब्जेक्ट्स हैं उससे हो गया, और मेडिसिन में भी जो कोर टॉपिक्स हो गए अपने ईसीजी, एसिड बेस्ड डिसऑर्डर्स, ठीक है, स्ट्रोक या फिर कोई भी इमरजेंसी वाली कंडीशन है अपने पास, ठीक है, ऑल द इमरजेंसीज दैट आर आस्क्ड इन द एग्जाम, so they are tend to get asked more in the INI. Okay. So you have to just focus on those areas in medicine. You don't have to devote entire thing, like you are studying Parkinson's in medicine, main notes Parkinson's is so long, you are studying Parkinson's so long, and there are very less chances the question might be asked only on the drug of choice for Parkinson's and all. So you have to just focus on those areas in those particular topics, and not the entire medicine topics, because that will be very cumbersome. Okay. And you can utilize all the PYQs that are on my group, and I have also highlighted some important topics for INICET on my channel only, so you can refer that for your quick revision. Okay. Now the main thing is that how to plan your day. So very simple. whatever subject you have planned for the day. Okay, suppose today I am starting with obs and gynae, है ना, obs and gynae या फिर pathology से start किया, तो अगर मैंने if I have revised completely for NEET PG, then I can directly do the retrograde manner and I can directly solve the PYQs of that particular topic that I am starting. Okay, and then highlight and annotate like I told you, and just highlight the forgettables or make the flashcards of those. And you have, if you have any confusion or anything that you are not able to understand, then you have to focus on that. Okay, because in PYQs all the important things are asked, and if you are having confusion in that, so don't leave that, don't skip that. You can skip those questions which are not asked previously easily, but if a question has been asked, then you have to focus on that. You have to go at least to a certain depth in that thing, so that if that is repeated in a modified manner, so you are able to answer that better in the coming INI. Okay, so if you have revised, then you can follow the retrograde manner. Otherwise, you just revise your notes, then solve the PYQs and then do those things. Okay. Then in the afternoon, like when you are tired, you have done one topic for that particular subject and solve the questions and highlighted and annotated your notes. So in the afternoon, you can just solve 19 subject PYQs. This is very, very essential. Okay, so that you have a touch with all the 19 subjects. Please don't do the things like only studying one subject, one subject, because you will forget things very, very quickly. And when you will solve at least 50 or 70 questions per day of all the 19 subjects, so you will at least have 2 to 3 topics from a particular subject, from every subject every day. So at least those subjects will, those topics from those subjects will be fresh in your mind. And when you will study those subjects, then they will come, okay, I solved this questions, मैंने तो like I solved this question yesterday and it came now. ठीक है, so you will also feel confident कि हाँ अभी मैंने इतना सारा, तो काफी सारे टॉपिक्स तो मैंने जो भी सब्जेक्ट है उसके वैसे ही कवर कर लिए. Now in the evening में आप क्या कर सकते हो? You have to just in the evening when you are tired and all, you just watch the remaining videos that you have left. ठीक है, just revise your notes, whatever topics are remaining, just do those things. ठीक है, and at the night, what I said you, whatever mistakes that you have identified in the day, you will not be able to open your notes back and then revise it all. Just make those flashcards or just bookmark those particular questions, like 10 to 20 questions, in which questions, like questions which have a language thing. Okay, language thing means ki the question was confusing a bit, you knew the concept, you knew the topic, you knew the options, but still you marked them wrong because you were not able to understand the question well. So in that case, making flashcard is not as beneficial. In that case, you have to bookmark that question and you have to solve that question again, because that question language or somehow it has been changed in a certain manner that you will be confused. Like in some confusers are there. Okay, so you have to bookmark those questions and solve that question again. So you will have a better idea ki, okay, why this is the thing and why this is not the thing. What I was thinking, although I knew the topic, but my thinking was wrong in that. So that is also very, very essential to be answered, because in INI, the major game is that like 140, 150 questions will be clear cut and everybody will be able to solve. 20, 30 questions will be like nobody will be able to solve. Those 20, 30 questions, you will get a rank of 1 to 10,000 in those 20 to 30 questions only. Okay, and that is what matters. So in those kind of questions in which you are getting confused by the language or by the options or those things, you have to focus on those questions or on those options, because they will be the ones that will trouble you in your final exam also. So I have also realized this, like, so there were so many things that I worked upon. I was confused in those things and I worked upon them. And in the final exam, when those things actually came, now I was able to answer them pretty well, because I knew the examiner is trying to confuse me. Like, you should practice so much that you know that examiner is trying to confuse you and trying to make unforced errors by you. Okay, what do we say? Unforced errors ki silly mistake ho gaya hai wo. They are doing that intentionally so that you commit silly mistakes, and you have to get out of that trap. Okay, so keep that thing in mind. है ना? Now, the common question that people ask me, what to do when you don't feel like studying. Okay, कि अभी बहुत पढ़ लिया, अभी मन नहीं कर रहा है पढ़ने का. So in those scenarios, you don't have to force yourself. Okay, Don't have to force yourself ki you are forcing yourself and just opening the same page for 10 minutes, 20 minutes, half an hour has passed and you are just wandering. So better just shut your book at that time. Okay, just take your mobile. Okay, just solve some questions from your mobile, from PYQs, or you can just roam around. You can just watch any of the TNDs videos, any of the MCQ discussion videos on the Marrow. You can watch anything passively. Okay, so this is when the passive reading comes. Hai na? So when passive, like why I'm telling you to solve MCQ discussion or TND videos, because in those things you will not be entirely passive, because the teacher will ask you the question and then your brain will automatically trigger. You will yourself from inside you, some answer will come, whether it will be right or not, some answer will come. So in that manner you are not completely passive, but you are putting some effort, so you will remember those things. Okay, so that is a better way, instead of just opening your notes in front of you and just flipping even when you don't feel like studying. So that will not help at all. Okay, but this thing will help you because somewhat your brain will be triggered in this sense. Okay, now if you have if you are studying surgery or obs gynae or pathology, so big subjects which are taking 4 5 days 6 days to complete, है ना, you will definitely be tired at the end of the day. So at the end of the day, if you want, you can just keep a short subject or some interesting things. Okay, so if you keep those things, then you just keep those things for 1 to 2 hours, so that you just have a chill pill कि हाँ चलो मैंने आज 1 hour एनेस्थीसिया पढ़ लिया, या आज 1 घंटा डर्मेटोलॉजी पढ़ लिया, या आज 1 घंटा मैंने कोई ऐसा टॉपिक, विच एवर टॉपिक यू फाइंड इंटरेस्टिंग और यू हैड डाउट अर्लियर, you want to do that in depth, so you did that, then you will feel a good, matlab, that will give you a good feel. Okay, because studying the same subject entire day, this for 5 to 6 days, that can be cumbersome. So you can just adjust a bit, adjust a little. You can revise your previous subject that you did. You can solve some questions at night. So those things will help you to get out of that trap ki, oh my, so much like surgery is so vast, I am not able to remember that and I am not able to do that. So at the end of the day, keep things light, on a lighter note, so that you don't feel overwhelmed at the end of the day while sleeping, because that will not allow you to sleep well also. But if you will keep a chill thing at the night, then you will be able to do that thing well, and also you will be able to relax and go back to sleep easily. Okay, and in the morning, target those things that you are finding difficult, that are bulky in nature, because your brain is fresh, your mind is fresh, so you will be able to do those things pretty well in the morning. Okay, so you have to plan your day, your time accordingly, है ना? Resources, I have already told. If you have done any of the resource till now, just stick to that. Okay, either trim it down or layer it up, as I told you, by highlighting, by annotating the notes, है ना, ये एक चीज करनी है. Or if you have not done anything now, like if you have some subjects remaining, then I will advise you, instead of going to main notes, just you can go for Marrow RR or BTR or any other short source that you find useful. You can just go for that subject now. No point in starting the subject from main notes at this point of time, because that will take 10 12 days, and you will not be able to revise that after also. So no point now in doing that. If you have done main notes of any subject till now, then that's fine, but don't do from now. Okay, if you have done already the main notes, you have studied them, you have revised them, then you can highlight and annotate in them. Like I had my anatomy notes, I had my micro notes, they were my main notes only, and patho notes, they were my main notes, and I highlighted and annotated in that. But I was able to revise them quickly because of highlighting and annotating. Okay, so that was the thing. So you have to make sure about that also. Now, common question, very common question about the GT analysis. So I don't know why people are so much confused about GT analysis, and there are so many queries about GT analysis. You have to keep GTs very simple. Okay, see, the first aim, the major aim of GT is to solve the questions in a time bound manner, to adapt you to the exam environment. That's the main purpose of solving the GTs. Okay, in GTs, if you are not able to solve all the questions in the certain time in the particular slot, then that is an alarming situation. You have to cover up that. First, you don't have to think about the incorrects and all. First, you have to come to that point ki, okay, you are able to solve at least those things. You are not leaving anything. You are able to solve the complete paper. Okay, you have to come at that level. Now, talking about 4 kind of questions in GTs. Okay, so ones are correct that you knew and you are able to answer them pretty well. So those are, so you don't have to see them. Like people ask me, do we have to cover all the 200 questions? Do we have? No, you will not be able to cover. And if you will be able to cover, you will waste a lot of time. You will feel like, oh, I am revising the GT for the whole week. Even I have seen people revising GT for whole month. Don't do those kind of things. Okay, just take 2 to 3 days maximum to finish with your GT revision. Don't do the correct. First, start with the skipped ones. Okay, skipped ones se start karo, then go to incorrect ones, then go to guessed correct ones. Okay, in that fashion you have to go. Even if you are, if you have less time in future, like when 15 days are remaining or last month is remaining, then you can skip the guessed correct part also. You can just do the skipped and incorrect part. Okay, so in these 3 things, what you have to do, you have to just see the question. You have to see whether it is a PYT or a PYQ. And if it is a PYT or PY2, then it should alarm you. Okay, then you should be triggered. Okay, I have to solve this in depth. Okay, you have to do in-depth analysis of that question, of those questions only, either from the explanation that is there. Okay, any pearl that is attached with the question or anything that is attached, you have to revisit the notes of that thing, hai na, ki why it went wrong and how can I not made the same mistake. Because the entire purpose of studying or for a competitive exam is you have to study in a manner so that you make, जो repeated mistakes होती है ना, वो बिल्कुल zero होनी चाहिए. मतलब like you have to do repeated mistakes till the exam has come. But on the exam day, all those mistakes that you have done so many times that this time you have to do them right. Okay, so you have to go in that fashion. So you don't have to spend your entire time in a question like if it is not, it is like some absurd question, some values asked, random values asked, random fact is asked. You don't have to bother about that. You just have to read that and skip that. Okay, don't have to pay much attention in that because that is a GT. In final exam also those kind of questions will come, but you have to don't have to bother about those questions. Okay, in this NEET also rank 1 I heard that got 707 marks. So see, 20 questions, 19, 20 questions, even the topper is getting wrong. Okay, so 20 questions you can easily matlab, go wrong in the exam without any worry. So don't worry about those questions in the GTs which are out of your notes, which are out of the PYTs or PYQs. Just read the explanation and just go with that. Even don't bookmark those. Okay, because at the end of the time what comes, people bookmark so many things and then they are not able to revise. Even that happened with me also. Okay, so you have to even use all the 3 bookmarks like star hai, question mark hai and normal wala bookmark hai. So jo PYQs hai, if you are making any mistake in PYQs, just highlight them with star or question mark so that those are separate and you are able to revise those. Okay, rest of the questions if you are not able to revise, then that will not matter. You just have to aim that I will be able to revise all my PYQ mistakes or PYT mistakes that I have done at the last 1 month, because that will only provide you the boost or that will only provide you the confidence that you need for the exam. Okay, so you have to go in that manner. And in my YouTube video, I have told how to make flashcards and all. Okay, in a separate video, you can just go there and you can just see that I have already told that in detail there. ठीक है, कैसे बनाना है, क्लासिफिकेशन को कैसे याद करना है, ड्यूरेशन को कैसे याद करना है. ठीक है, I have already made that, so just go and see that. Okay, now see, 2.5 months is a very long time, है ना? And moments will come when you will feel lost, when you will feel like why I am doing this, why I am into this, I don't want to do this. ठीक है, all these things will come. You will feel demotivated and all those things will come. So you have to just maintain a calm mind, है ना? Even if a day goes bad, you just have to take it as a day, and then you have to take the another day as a fresh day. Never do those things like if you are not able to study for the entire day and you are studying, you are rising whole night and then studying, and then next day you are not able to again study. So don't be in that trap. If a day gets wasted, just take that as wasted and just start your next day at the same time that you are starting your days. Okay, don't do those kind of things now ki we are doing late night sessions, or if you are studying late night, then that's fine. But if you are studying from morning, your routine is fixed, then you have to go in that routine only. Because when you break a routine, sometimes you are studying at night, sometimes you are rising early, you are not sleeping properly. So those all things culminate, that will bring anger inside you, that will bring frustration inside you. So those things will happen. And if a day ends bad, then end that and then start the next day fresh. Okay. And starting the next day fresh is very, very important. And you have to, in the morning, you have to rise. Okay. You have to pray or anything. You have to do exercise. You have to roam a bit. Whatever you have to do in the morning, you have to just make your mind calm and composed. Okay. I have to study these things. Just stick your particular day schedule in front of you and just go according to that. In afternoon, if you are not able to study, just do slight stretching, just walk around, just see some videos. Okay, just relax, just do, थोड़ा सा relax भी जरूरी है लाइफ में. ऐसा नहीं है you have to just do work. That will not help. When you live your life in a balanced manner, then you will be more productive at your work. Your mind will feel better, your body will feel better, and you will be definitely able to perform better. So I have seen this with so many of the people who are studying so much and then they get burned out. So please avoid those things. Avoid being in a trap. Okay, just don't let your mind trap you in the negativity or in the loop, in the negative loop. Just if you are in that, just end your day on a bad note and then start, just think I will start the next day with a very, very high peak. I will just do all the things that are required. Okay, so you have to just maintain that positivity, that calmness with you. And in the night also, you have to just do deep breathing and just forget whatever happened in the entire day. Whatever has happened. Just plan something in your mind for the next day. Okay, ki I have to do those things, and then just go to sleep and remind yourself of your true potential every day. That is very, very essential. Like I used to do at least night mein deep breathing and reminding yourself of your true potential. You are here. Okay, you have cleared so many exams, you have cleared your MBBS, you are here as brilliant doctors. Okay, you will be making a very good specialist, you will become a very good super specialist in future. But you have to remind yourself, okay, of your true potential. Just don't forget that. You have to remind yourself, I am far better than so many people, than so many people. Okay, you have to think that, because that will only boost you, that will help you to motivate you, that will help you to work better, to be happy in your life, whatever you have. Okay, so those things are very, very essential. So just restart now. If your NEET PG didn't go well, just restart, refocus, reclaim. Okay, and best wishes from my side, and my heartfelt thanks to all of you for joining the session. And if you have any of the queries now, then I will be more than happy to answer those things. Okay, so
Akhil,
we can just,
to start with, there are a couple of people, they are like, they are in the range of rank 10 to 20K and then more than 20K. And then they want to sit for I9 now, and there's so much information going out there that if you are more than 5,000 rank, you shouldn't sit for I9, or if you're more than 10,000 rank, you shouldn't sit for I9. If we'll cover a bit on that, that even if you are 40, 50,000, how you can approach the INI, or should you sit for it or not?
definitely. Like I jumped from 284 to directly from 284 rank to rank 6. Okay, so that is a jump of approximately how many times? 50 times at least, है ना? नहीं कितना होगा, जितना भी है, ठीक है. At least 2 zeros I am able to reduce, मतलब 2 digits from my rank. 3 digits से 1 digit आया. So if you are a 5 digits, 10,000 is 5 digit, right? So if you are a 5 digit, then you can definitely get into 3 digit. Well, there is no doubt about it. If you are having a rank above 5,000, you are having 4-digit rank, okay, between 5,000 to 10,000. You can definitely go into a 3-digit rank, so is definitely possible. And if you work well, if you devote all your time, if you devote yourself to November and then you can hit a double-digit rank also. That is very, very much achievable in these 2.5 months. Believe me, I have seen so many in my own college. I have seen so many people who did extremely poor in their NEET PG or those things. But the thing is that what I said in the starting, na, result will not count. Your effort for the next destination, okay, your effort for the next exam that you are going to give, that will count. It will not matter. The NEET results will not matter. INI people will not ask you if you are only top 10,000, then only we will take you in our institute. No, they're not concerned about that. There are so many people who have got above 10,000 rank and they have hit double digit or triple digit rank pretty easily. And at double digit and triple digit, there is a very, very huge scope of getting a very good branch in a very good institute. Okay. So INI में भी अभी seats increase हुए हैं and at least in top 1,000 so you can get your desired branch in a very good institute. So just don't be like कि मेरा 20,000 आया 40,000 आया. Just don't be that in denial. And even if you feel कि INI is not for you, okay, but if you will prepare for INI, okay, just prepare for INI, है ना. एक बार के लिए रिजल्ट को भूल जाता है INI कि just forget about the result. Anyways you will prepare for next NEET, है ना. So just take कि हाँ I am starting preparation for next NEET, but this exam will come in between and I have to prepare that for that also, and that will help me in future, you know, that will not harm you in any manner if you prepare for this exam. And the preparation, the concepts, the topics, all those things are same whether it is NEET, whether it is INI. So just please don't be, what I said in the last na, don't be in a negative loop. That is what is the troubling situation of all the medical students preparing for competitive exam, because they are trapped in the negative loop. So you have to come out of that. That is very, very essential for preparing for any competitive exam or preparing for anything in your life. You have to have your body, you have to have your mind in that positive setting, in that positive frame of mind. Then only you will be able to achieve your true potential. The only aim of preparing for me was कि I have to reach my true potential. I attained a single digit rank in my UG days also. So I was like कि ठीक है अभी अगर if I went wrong, if I did something wrong, ठीक है I will attempt it. Whatever will happen. But I have to reach, I have to give my all. I have to reach my true potential, whatever it is. If it is triple digit, if it is 4 digit, that doesn't matter. But you just have to give your full, explore your full potential, because for many of you, if you are taking a end branch, this will be the last competitive exam, right? So just think about that कि ये मेरा last potential है, last chance है to show my true potential. Just think in that manner and give the exam in that state of mind.
Fair enough. And don't go for those messages that you shouldn't sit for it, or like let the people say that you shouldn't do it, you shouldn't sit for it. Everything's our opinion. Your parents have an opinion, your friends have an opinion, but that's not your destiny until unless you accept it. So don't accept whatever is coming out. Yeah.
There are many examples. Even I am in front of you. There are so many examples who have done this. Just you have to see those. I am saying now you have to see those positive things and get out of that negativity. You have to focus on the positive things.
So there are a couple of questions in the chat, starting with there is what to do if ANAT, Biochem and Path are weak. I'm just watching RR now, how to make it more stronger.
So if you're ANAT, ANAT Biochem Path. So Biochem to is pretty simple. You do Marrow RR or PTR, and then in the fashion I told you, just solve the topic wise PYQs from my Telegram channel, annotate your notes, and you have to revise that, because Biochem is more than concepts, it is about cramming. Okay, so that's for sure. So you have to just see the cycles and just make a flashcard of those cycle or those particular enzymes that you are forgetting. There are so many confusing enzymes in biochemistry, so many confusing amino acids in the biochemistry. Okay? Genetics is a bit confusing. So you have to focus on those things. Definitely biochem में तो concepts का इतना ज़्यादा requirement नहीं है. जितना भी है that is concentrated in RR or BTR and all. ठीक है? In path also that is true. In ANAT I feel कि ANAT is the thing कि just do topic wise. Okay, just don't feel like I have to make good concepts in ANAT or anything like that, because in ANAT making concepts is very, very difficult. You have to study then in entire detail from the main notes. If you have not done those main notes, then it will be difficult. If you are studying BTR, even I found it difficult. I was studying on BTR or RR. You will find anatomy difficult, because for understanding the neuroanatomy and all those interlinked connections and all, you have to study the anatomy in a particular detail, like Ashwini sir tells, or his main notes are there. So if you're preparing for INI and you don't feel like the anatomy is weak, so what I did, I just solved all the PYQs of anatomy. Okay, what all topics were coming? Okay, if some nerve topic was coming, if some lesion topic was coming, okay, if some embryological topic was coming, and embryology is also a bit difficult, neuronat is a bit difficult, head and neck is a bit complex, lower limb also I found nerves and all those were a bit complex. I was not able to understand even at the last moment pretty well. ठीक है, जो भी origin होता है nerve का, L1 lumbar plexus से ही आते हैं, all those supply and all. So you have to just see those particular question कि हाँ foot drop का question आएगा, ये वाला इसका आंसर है, कॉमन पेरोनियल नर्व से निकल के अपनी जाती है ये वाली ब्रांच. So just you have to focus on those particular things. So first solve the questions. ठीक है, solve the questions, just see those things कि हाँ इस topic से question आया, just study those topics. Forget about studying the sub anatomy completely and understanding it and making concepts in that. Just forget about that. Just solve the questions. ठीक है, go to your notes, see how I can remember it. You have to remember it. Okay, just think that कि cram ही करना है इसको. Just remember कि अगर ऐसा question आया, so I will tweak it like this and I will remember like this. And if the same question comes or same similar topic comes, I will answer. Otherwise, if a different topic comes or those things come, I will not bother at all. Okay, because in anatomy INI asks in so much detail that even if you have studied in detail now, you will not be able to answer. They are asking cross section at any level possible. Okay, so you will not be able to answer those things or all. Just study, हाँ T3 T4 का पता होना चाहिए, cross section ये वाले एक दो cross section बस पता होना चाहिए, that's it. You don't have to study all the cross sections, all the structures and all. Just only the important things you have to focus. Out of 12 to 15 questions come from ANAT. Okay, so out of 12 to 15, even if you are able to answer 7-8 questions, then that's good. And you will be able to answer 7-8 questions if you follow this approach. Don't worry about that. You can leave 4-5 questions, that will not matter much.
There's one question saying, is surgical hands-on are less in INI institutes? Is it a question or is after this?
No, surgical hands-on, it actually depends on various institutes. Like if you go to AIIMS Delhi and all, which are more central institutes, and
we'll talk about questions like colleges and once the INI thing will be over. Because
I think that will be right time. But in short, if there are so many SRs and because in central institutes there is like a burden of key, if any infection happens or if anything wrong happens, then they have more burden compared to state institutes. In state institutes, the junior will get the cut. But in peripheral AIIMS, like in AIIMS Jodhpur and all, the juniors are getting cut and all. So it's not like that you will not learn anything or you will get your academics will be better. Even if you get a little less hands-on, then you can easily cover that in your senior residency. That's not a point. So just you have to think about the particular institute that you are going. Just ask the surgical residents there, then you will get a better answer to that.
Yeah, I'll add one more point regarding the surgery residency. If anyone preferring taking surgery, according to what I have seen and what I have talked to the other resident working in all over AIIMS and PGI and GIPMER, please avoid central institutes for general surgery, because I have last time I talked to one girl. She has completed her general surgery from PGI Chandigarh. In whole of the 3 years, she just got one chance to open the abdomen. So you can assume how many chances you're gonna get to do the surgery thing. It's better to go for the state hospitals and state medical colleges. So you'll get more hands-on, because surgery is overall more hands-on. After that, all the things will come in a way after you will do the super specialization. So it's better to go for state hospitals in spite of going for central institutes. Like I've talked to one student doing her MS from AIIMS Delhi. She left AIIMS Delhi just after 2 months because she was not getting any hands-on and other things. And many people have left after doing their residency from last 1 year. So think about it and then choose for the surgical branches. For the medicine, the central institutes are you all of you know that it's far better than any of the medical colleges.
Yeah, that's very true, sir. Matlab, even I had some known people in Safdarjung Hospital taking obs gynae after leaving AIIMS Delhi because they were not getting hands-on over there. But definitely for medicinal branches, central institutes are best because you will get all the equipments, all the drugs, all the standard protocols will be followed. So if you are targeting for medicinal branches, that's why I said in starting, you have to aim for INI. If for surgical branches, then you can pick with NEET also.
Sir, I'd like to interrupt. I think it's more of the motivation which a person has and the amount which the patients are coming and all. I also am an Amazonian, and in my college, my senior, who's the first year JR, he got laparoscopy gram patch repair in his first semester, sir. So if he's getting laparoscopic exposure in first year, so you can imagine what kind of exposure they can get in second year or third year. So I think it's a subjective approach. You should not generalize it to every institute.
Yeah,
Yes.
I'll add one more point. In the Safdarjung Hospital, one of my batchmen was there in final year. In
I
final
think
years,
they
he
are
get a chance
getting
to do the
distracted
laparoscopic
from
surgery
the.
just for the lab cholecystectomy. I'm quoting the example. And for you are telling for the gram patch repair, just handling the camera is not doing the laparoscopic surgery. You
No,
will
no,
get
he
chance to
did
do
it
the
solo
handling the
only.
camera.
The
You'll
We,
not
emergency
get
में
we,
chance
किया
to
है
I
do the
उन्होंने.
have to, I
surgeries
have to
there.
Okay,
stop
just
there, and
uh,
I have to stop you all of you
we will
because
have
this
that
is about like
discussions
how to
after
write the exam.
INI.
This type of discussion we'll definitely have when we are talking about the counseling thing. This because right now it's all about writing the paper. Once we'll have colleges to choose from, then we'll decide that whether to go for whichever college, because it's very college and branch dependent. We'll pick it up that particular time. Now the problem is that they have to write the exam. So let's focus on that. So there is one question that only PYQ needs to be annotated, kya for Akhil, for you? When you say that annotation has to be done, only PYQ needs to be do that?
Yeah. If you have, see, if you have your base notes, you have core notes, you have to just annotate the PYQs in your notes, because what will happen if you will add anything in your test or anything from your GT, then those will become bulky, and the entire purpose of making notes is that you are able to revise in a better and faster manner. Okay, so that purpose I think will get defeated somehow, because only 2.5 months is left. Okay, if you have like, if you are preparing in the second year or so, then I will tell, okay, you can add from QBank or you can add from GT or and all, but it's not the time. Okay, it's last 3 months or 2.5 months, so it's not the time to add anything unnecessary that will trouble you after. Suppose if you have annotated that, and when you will see that after 1 month, oh, I have written this, I have written this, I have written this, and I don't remember anything. So then what's the point? You will not be able to segregate what I have to remember now and what I have to leave now. But if you have highlighted only PYQ, then it will be in your mind that I have to do this well. ये तो मुझे करना ही है. Even if I don't remember this now, I have to do this well. Okay. But if you will have so many things, then you will not be able to do that.
Okay, and then there is thing how to approach classification question which was asked once in a while. What is this?
I also remember some classification question was asked in the last May INI or so. Okay, so some random question from classifications come. You will not have heard even the name of those classifications and all. So you can just leave that in exam. If you want to study classifications, I am saying you please study the classifications that are asked previously. Okay, GCS जो हो गया, ठीक है, people are still committing errors in GCS. Okay, I also committed errors in GCS till the last moment of the exam. Okay, I have committed errors, so you have to master those things. You have to master Brunner's grading or anything. Those are important. ठीक है, जो भी important questions जो भी आए हुए हैं PYQs में, जितने भी क्लासिफिकेशन के आए हुए हैं एंटायर GIT के अंदर जो भी क्लासिफिकेशंस हैं, ठीक है, यू हैव टू डू दोज थिंग्स. ठीक है, जितनी भी है अपनी क्लासिफिकेशंस, चाइल्ड पोग एंड ऑल, यू हैव टू मास्टर दोज थिंग्स, not the random classifications, because there are so many classifications. Now I am studying in residence, there are so many classifications, there are so many scores that are used, but those are not if they are asked in exam, you have to just leave them. Okay, you don't have to even put your brain in those. You have to just do those classifications that are asked in PYQs, according to me.
And for now, should they focus on QBank or just custom random PYQ with AIIMS tag?
No, my point is that if you will focus on QBank, the QBank is so huge. you will be able to do the QBank once, but what's the point of doing anything once? Okay, there is no point. If you will, instead of doing QBank, if you do PYQs thrice, okay, and your TNDs or your GTs, okay, more, then that will be more beneficial. Because doing QBank, you will do QBank, you will bookmark so many things, you will do so many unnecessary things, you will unnecessarily clutter yourself, you will unnecessarily burden yourself. So I don't think there is a point in that. According to me, if even if you are aiming for a double-digit rank in INI, you don't need to do QBank. You have to do custom modules more and more. You have to do TNDs more and more. You have to do GTs more and more. That's the approach to solve the questions. Okay, you have to do those things rather than solving QBank at this point. You can solve QBank only of the topics like ECG हो गया या ABG हो गया, ठीक है. I solved only particular QBanks which have the मतलब like इसमें से तो questions आनी है या फिर 2 to 3 questions are asked from this, then you have to do like glycogen storage disorders हो गया, lysosomal storage disorders हो गया. You can do QBank of those topics, not entire, just only and only those topics.
And how many GTs should they write? And last year AIIMS question, INI question, past how many questions they should practice?
You should write from now on at least 1 GT per week. You should write, because see, writing GT na that if that demotivates you, then that should not be the thing. For me, GT was like a tool. Ki if I am struggling a bit, my week didn't go well. When I used to solve GT, I got to know, oh, there are so many things. I have learned 200 topics in just 3 hours. I have solved 200 topic questions. Okay, so that has opened my mind. That has taught me so many things. Okay, you have to look GT in that manner, and you don't have to overanalyze. That's why I said don't overanalyze your GT. Random questions are coming, just leave those questions. Okay, you just read the explanation, just leave those questions. But if you are doing the PYTs wrong in your GT, then you have to be alarmed. You have to do those things well. You have to make flashcard, or you have to go to your notes. You have to revisit that topic. Only do those things which are necessary right now.
And should they do only INI based GTs or and skip NEET PG based GTs?
No. You can do both the GTs for now. In the last 1 month, you can do just INI based GTs. But for now, like Marrow gives you GTs based on NEET only. I think INI ke GT to sirf two or three GT they will give for mock INI. Rest of the GTs will be in NEET pattern only. So solve those also.
Okay. I know there are so many of you are raising your hands. So starting with Harshita, you can unmute and ask your question. I've seen there are a lot of questions. I'll give everybody a chance to unmute and ask, starting with Harshita.
Sir, so I've been preparing for my NEET PG preparation for like 4.5 to 5 months, and I kind of secured around 25,000 rank. Can I aim for medicine, a good medicine seat in any of the AIIMS institute? Will I be able to score that? How can I approach my preparation? I have
So
that.
that's I see this. This is like a thing that you are not thinking about the exam. You are thinking about the result of the exam, and after that, what you will get. You are thinking beyond counseling part. Okay, so you have to go step by step. If you want anything, okay, or if you don't want anything, you have to prepare for the November INI. Okay, if you will think that thing in mind, will I get that AIIMS, will I get that medicine seat in AIIMS? If you will have so much far thinking, well, it's not bad to think. You should have a dream ki I want to have this seat in this, but you
Yes.
should, the way you are thinking ki, will I get that or not, that's a secondary question. Okay, the primary question that has to be answered, that I told you in the last, was did you reach your full potential? Okay, that's the primary question to be answered right now. You have to reach your full potential. I'm not saying ki your full potential is only single digit or double digit. Even triple digit or 4 digit rank is full potential for someone, but you should realize yourself only ki I have reached that mark. Okay,
Yes.
so if you have reached that mark and then also you are not getting medicine or thing, you don't have to worry. You have to take the choice, the next choice that you have. Okay, in life you will not get, every time get the desired things of your choice, and even if you get those desired things of your choice na, then also believe me कि no one is happy कि हाँ मेरे को ये चाहिए था और ये मिल भी जाता है, then also people are leaving things. People are leaving AIIMS Delhi seat, people are leaving different AIIMS seat, people are leaving PGI. So even after studying so many years and so much hard work, people are leaving that thing. That means ki that's not an indication of what you truly want. Okay, you
Yes.
truly want a satisfaction. For the exam point of view, you should just have satisfaction. Ki I have got this, and whatever I will get, I will do well in that. According to me,
Okay.
that should be your mindset. That will help you reach the full potential.
And
Okay.
this is for
So will,
anybody who's at this rank thinking that which college they get. Right now, only think about how to crack this exam. Once you'll have result in, so one, it will keep you grounded and give you less pressure and stress. Second, it will give you a good focused attempt that I should only have to study and finish the subject and see how I am improving. Because end of the day, it's all about improving your score, improving marks in your GD, and getting a good rank in INI. College and all, everything will happen gradually.
Yeah, very true. You have to just see कि हाँ मेरे को इस सब्जेक्ट में इतना आता है. Last time I am studying these all 19 subjects, ठीक है. तो अब how much more can I know in these subjects? How much better can I do? You just have to think about that. Keep your thinking simple, because that will help you to reach great heights.
okay, sir. So will you do any exam day kind of strategy video in your YouTube channel or something, sir, if possible?
Yeah. In future I will do,
Okay.
definitely.
That would be so
So
helpful, sir, because in the last day, many of us are doing some mistakes and kind of
Hmm.
ruining. So that would
Okay,
be
okay.
so
we'll,
helpful.
I
we'll
will do
see.
that.
Akhil, there's a couple of questions on that ground that what if NEET PG counseling starts in between the INI prep? How should we manage both?
So similar
I think
thing
that's
was happened to me also. NEET PG counseling was there, and INI preparation was there. So see, I am not saying that you should waste your NEET PG rank. You have got any rank, you should aim for getting the best branch in the best college possible to NEET PG also. Okay, just don't think कि I will to only take INI and I will just leave NEET PG counseling. Now this is the best time because you are not in full mode of preparation for INI. Okay, this August you have 8 to 10 days. Okay, spend these 8 to 10 days in deciding what you have to fill in the NEET. Okay, just take these 8 to 10 days, then just leave. Then whenever counseling comes, you just fill what you have decided right now, or if you want to change a bit. Okay, now is the time you can think. But after like when the NEET PG counseling is announced, and then you will start thinking, then I think you will make waste much more time, and when you are in full flow of study, then your study will break, then that will demotivate you a bit. So better now you are only starting with the INI preparation, so now only just spend 2 hours daily, 1 to 2 hours daily in the counseling process. Okay, not the counseling process, but deciding what branch or what college you can get at that rank. You have Zynerd and all those apps also for that, and you can ask your seniors also कि मेरी rank पर, because of ranks आ गए हैं. ठीक है, अब वो वाली बात नहीं, रैंक्स नहीं आए हैं, पता ही नहीं है क्या रैंक आएगी. नाउ यू नो द रैंक, यू नो द अप्रोक्सीमेट थिंग दैट यू कैन गेट. ठीक है, जस्ट उसके ऊपर 2-3 और उसके नीचे 2-3 डिसाइड कर लो कि हाँ इतना तक जा सकता है. लाइक इफ योर रैंक इज 7,000, जस्ट सी 5 to 10,000 में क्या क्या मेरे को बेस्ट मिल सकता है. ठीक है, अप्रोक्सीमेटली वही रेंज रहेगा. ठीक है, जस्ट सी 5 to 10,000 रेंज. इफ यू हैव गॉट 2,000 रैंक, जस्ट सी 1 to 5,000 रेंज. लाइक दैट यू हैव टू सी. ठीक है, थोड़ा सा अपना रेंज देखकर कि हाँ मेरे पास ये चॉइसेस हैं, and out of these this will be my choice list, and whenever counseling will come I will fill that. So spend 2 hours daily for that now. ठीक है, don't spend too much time when the counseling is announced and all that thing, because counseling will be announced, it will be delayed, some court issues will come, some things those sort will come. You just sort that out right now only, because your rank is there, and just be uh, keep away from those particular things and just prepare for your INI during that time.
Yeah, and don't over stress on that because like just give us this weekend. We will anyway provide you the after compiling all the list of what happened in the last year range. So you'll able to get that range that will I be able to get a DNB or MDMS in this particular range in which college. So just wait till this weekend. Don't over stress. We'll help you out there. Coming back to Lakshmi Narayan, yes, please ask your question. You are on mute. First unmute yourself. There's a mute button. Yeah.
Unmute yourself first.
So there's a button like mic in the
Hello.
bottom. Yes.
Sir, can you please give advice for INI May next?
Next INI
So you're
May.
preparing next
Yeah.
INI May.
Yeah,
You
for
still
the
have time, Lakshmi.
No, if you are
So
preparing for next INI May, my advices will be same only. Okay, just your schedule will vary a bit. The people are giving 3 to 5 days for a subject here. You can give a bit more time to subjects, like you can give 8 9 days to long subjects like obs-gynae surgery, 6 7 days to pathology pharmacology. You can just give that double time the people are giving for INI November. Okay, just give the double time, and but you have to follow the process is same. The process that I told you, that you have to follow in the similar manner. Just you can devote more time, you can go in more depth of those topics. That's the only difference that is there.
perfect. Daksh, so I will take quick questions quickly. Okay, everybody. Daksh, your turn. You can ask. Oh, I think Daksh is not audible. Perfect. Take it.
Ma'am, I'm audible.
Yeah,
Yes,
yeah,
yes.
you are.
Good evening, sir. Sir, I scored around 2206 in this NEET. So back of the mind, it's like continuously going on to whether to continue with seat in NEET by via NEET, or like I gave one GT of INICET, like INICET in 2 days back. But sir,
Okay.
at back of mind, it's going on like let's leave this rat race and just take the seat.
No. What are you desiring? What branch are you willing to take?
So like I'm getting MD medicine not in Delhi, Mumbai, obviously, but yes, I'm getting in Chhattisgarh or like in Bhopal. So
So the thing is like, see, there are two things now, है ना? You can chill a bit and you can study, ठीक है? If you are burned out, are you in a burned out situation कि अब और नहीं कर सकता मैं आगे future में? Are you in that situation?
no sir, no sir. Like in May and I also I got like 1173, but कुछ मिला नहीं सर, तो बहुत उसके कारण ना like बहुत डिमोटिवेशन लगता है मेरे को आईएनआई के लिए
No,
हमेशा.
no. So see, that's the thing. You are desiring for MD medicine, so that's definitely a bit difficult in INI. Okay, you have to get at least in top 100 rank if you are general category student to get MD medicine seat in a good AIIMS. है ना? So
Okay.
that's the thing. So the thing is that you in this situation, na, if you are feeling like that, give yourself some more time. Okay, just think about your 1 to 5K के बीच में जहां भी medicine best मिला है, think about that. ठीक है, so once you are satisfied कि okay, I will get these things, I have already made my NEET PG कि NEET PG counseling आएगा, so I will fill that. ठीक है, once you are done with that, ठीक है, just remove that load with you, है ना, remove that load from you. Now in the further days, whatever you want to do, okay, you are at home, right? So whatever you want to do, you want to like I said, you want to play, you want to follow some of your passion, you want to follow some of your hobby, so do that for 3 to 4 hours. You can start from less, you can start from 4 to 5 hours, or what you can do, you can just solve questions. Okay, just solve the PYQs of INI, just solve the GTs that are coming, just do that. And whatever mistakes you are committing in them, because you have got a good rank, है ना, you have got a good rank, that means you have a good grasp on your notes, you have done good revision. So just solve the PYQs, just solve the GT, and whatever mistakes that you are doing, just do those. So you devote 5 to 6 hours a day. Okay, like you rest of the day, you 20 hours, you enjoy your thing and you do all the things.
Um,
Devote 5 to 6 hours in these things. ठीक है, so that will give you a satisfaction कि okay, I am able to do whatever is there in my mind. ठीक है, मेरी मन की भी मैं कर रहा हूँ, और साथ में थोड़ा सा टाइम मिल रहा है यदि मेरे को, तो मैं ये भी कर रहा हूँ.
sir,
Perfect.
one more doubt.
Perfect. Daksh, we'll take one question because there's so many people waiting
Okay,
out
okay,
here.
ma'am. Sure, ma'am. Thank
We'll
you.
we'll take your question offline after this if that's okay. ठीक है?
Sure, ma'am.
Have
Thank you.
You're welcome. Ahan, you are waiting for a very long time. Ask your questions. Okay, Namit, you can unmute yourself and ask. I think Ahan left, or I have no idea. Namit? Oh,
Yes, ma'am. Hello, Akhil sir. Good evening. First of all, it's an honor to speak with you. Whatever you have achieved is truly inspirational and really commendable, and to all of us.
Thank you so much. Thanks a lot.
सर माय क्वेश्चन वाज कि मतलब मैं सर जैसे आई हैव स्टडीड माय नोट्स ओनली वंस, मतलब आई एम अ इंटर्न ओनली. दिस
Okay,
दिस वाज माय internship attempt. In
okay,
May I got 6K rank, and in NEET PG I got like 4K rank around.
Okay.
So I'm aspiring for a surgical branch, and I think I'll get that from my state top college. But sir, I'm aspiring as being a Central Institute student. I'm aspiring for a Central Institute.
You are from
Uh,
AIIMS only.
yes, sir.
Okay. Nice.
So I was planning to prepare for INI, but the thing is, I have studied my notes only once. And what happens is, matlab, now I see the notes, I'm not able to link it. I like to solve questions. I've solved many questions. Matlab. I haven't solved
Like,
QBank, but
so like you are thinking is right only. I think you should go for INI because for AIIMSonians there is quota also, right? So now to
IP.
are getting surgical seat at a rank less also, okay, at a very less
Yeah.
rank also.
Yes.
So now complete your question.
हाँ सर, तो मतलब द थिंग इज मैंने नोट्स सिर्फ एक बार ही पढ़े हैं, एंड अब मैं नोट्स को वापस देखता हूँ तो आई एम नॉट एबल टू रिकलेक्ट कि कहाँ से कैसे पढ़ाया था. मतलब आई सॉल्व द क्वेश्चंस, मतलब मैंने क्यू बैंक नहीं किया, आई सॉल्व कस्टम्स, आई सॉल्व ऑल द टेलीग्राम क्विजेस, पता नहीं कहाँ के सर. आई सॉल्व क्वेश्चंस अ लॉट सर, बट आई हैव स्टडीड द नोट्स. बट नाउ आई एम कंफ्यूज सर एज टू वेदर आई शुड गो विद द
See,
नोट्स और
अभी दो चीजें हैं. If you want to prepare very well for INI, and the other thing is you can take branch from NEET also, and you just want to prepare like one of the people asked, one of the person asked here कि 2206 जिसका रैंक था कि अब मैं कैसे करूँ. So you can, there are two things, ठीक है. अगर आपका ऐसा दूसरा वाला mentality जो उसका था, तो you can just solve questions like I told him, just solve the PYQ, just solve the custom, just solve the GTs. But if you really want a good rank, ठीक है, in INI, then you have to put some more efforts. So if you have solved questions first, then and if you are not thorough with your notes, then you have to at least be thorough with your notes once. Okay, like I said, I mark the approach for completed notes once. Okay, you have to just be thorough with your notes once. Just flip over the pages quickly. Just see what all is covered in your notes, because you have also got a good rank, so you have better idea कि हाँ आपको idea तो है कि what all is there, क्या क्या topics के अंदर क्या क्या चीजें हैं. You just have to be familiar with your notes, then solve the PYQs, and then annotate and highlight and do all those efforts that is required to get a good rank. ठीक है. If you are in that state of mind, then you have to definitely devote yourself more.
yes sir, I'm not burnout sir, I want to give in one last time, मतलब. So
But
that's why.
If you want to give, if you have that mentality, na, then
Yes sir.
just if you have covered subjects pretty well, like if you are confident कि हाँ I have good notes, then you can go with them. You can just revise them. You can just solve the questions. And in subjects you are not confident about कि इसका बहुत ज़्यादा bulky है notes, या फिर इसके notes तो अब हो ही नहीं पाएंगे, मैं इसको मैंने पहले पढ़ा ही नहीं है बिल्कुल भी, then you can go for BTR or Marrow RR. ठीक है. You can use them as your base and then build up as I told previously.
Okay, thank you sir, thank you.
perfect. Ritika, you can ask your question.
Am I audible?
Yes, you are.
सर वो मैंने मेरा INI में रैंक था 15,000 ऐसे, और अभी नीट पीजी में इट बिकेम लाइक अराउंड 40,000 एंड आई एम एब्सोल्युटली लाइक एकदम से मेरे को समझ में ही नहीं आया मैंने क्या गलती की है. एंड आई डिड रीड माई नोट्स मल्टीपल टाइम्स. मैंने भाटिया कोचिंग से नोट्स लिए हैं सर. मैंने नोट्स पढ़े बहुत बार. मैंने GTs भी दिए वीकली. आई डिड हैव माई 20th नोटबुक. आई डिड क्वेश्चंस लाइक 100-200 हर दिन कस्टम्स में करती थी. आई डोंट नो, आई रियली डोंट नो वेयर इट ऑल वेंट रॉन्ग. मेरे GT स्कोर्स भी मेरे 140 करेक्ट से ज़्यादा कभी गए नहीं ऑनेस्टली, बट इवेंचुअली इन द मेन एग्जाम तो जितने मेरे GTs में आते थे उतने भी नहीं आए. नीदर आई वॉज एंशियस ड्यूरिंग माई एग्जाम. आई वॉज लाइक एब्सोल्युटली कूल माइंडेड, बट आई ऑनेस्टली डोंट नो व्हाट वेंट रॉन्ग. और मैं बहुत ही कंफ्यूज्ड हूँ कि इस INI में दूँ नहीं दूँ क्या करूँ सर. एकदम बहुत लॉस लग रहा है मेरे को.
नहीं, INI तो आपको ये देना ही है, बिकॉज नीट से तो अभी नहीं मिलेगा आपको. ठीक है. इस सिचुएशन के अंदर आपको जब समझ ही नहीं आ रहा बिल्कुल कि कहाँ पे गलती हुई, क्या हुई, तो फिर तो आप एक बार वही है कि आप एक बार पेपर को उठाओ और एक बार देखो कि सही तो आया ना आपका, क्योंकि क्या पता कुछ रिजल्ट के अंदर कुछ फ्लॉ तो नहीं है. क्या है, आपको अगर ऐसा लग रहा है कि मेरा बहुत अच्छा गया था पेपर, एंड इन स्पाइट ऑफ दैट, इफ दैट इज द थिंग, then just first see the answer की और see analyze your answers की क्या गलतियां हुई है. एंड जो भी है आपने पूरा पेपर को एनालिसिस करना ही जरूरी है. ठीक है, आपको एनालाइज करना ही पड़ेगा अभी ऐसे तो, क्योंकि कई बार होता है कि हाँ आपको लगता है कि सारी चीजें सही करी है मैंने, सब कुछ ठीक है, बट यू डोंट नो दैट बैंकिंग, तो वो आपने एनालाइज करा अपना पेपर, देखिए आंसर की या फिर कोई
नहीं,
एक्सप्लेनेशन?
अभी तक तो नहीं करा। मैं तो बहुत ही शॉक में थी, मैं तो देखने का भी एकदम अंदर से आ नहीं रहा था, बट आई
तो
विल।
फिर आप एक बार पहले अभी एक बार वो करो कि आप एक बार एनालाइज तो करो कि क्या पता, मतलब काफी सारी बार क्या होता है, वी स्टडी द थिंग्स, ठीक है, हमने पढ़ी होती है बट, और हमें ऐसा लगता है कि हमें आती हैं और हम लोग उसको मार्क भी कर देते हैं, बट फिर बाद में पता चलता है अरे यार इसमें तो ये था, ट्विस्ट की जो बात थी कि पेपर इजी है बट देयर आर ट्विस्ट, ठीक है। सो आई थिंक कि कहीं ना कहीं आपने वो जो ट्विस्ट वाले क्वेश्चंस थे जिसके अंदर थोड़ा एकदम डायरेक्टली लग रहा था कि हाँ यही होगा इसका, तो बट उसमें थोड़ा क्वेश्चन में ट्विस्ट था या ऑप्शंस में थोड़ा सा ट्विस्ट था, तो शायद आपसे वहां पर कुछ गलतियां हुई हैं जिसके कारण ऐसा हुआ है, बिकॉज अदरवाइज तो ऐसा नहीं होता। कहीं ना कहीं वो जो कंफ्यूजर्स होते हैं, जो एग्जामिनर इंटेंशनली डालता है कि ये वाले कंफ्यूजर्स तो डालने ही है ताकि एक्चुअल पता लगे कि क्या क्या डिफरेंस है, बिकॉज जो डायरेक्ट क्वेश्चन होंगे वो तो सभी सही कर देंगे, ठीक है, जो कंफ्यूजिंग क्वेश्चन होंगे, कंफ्यूजिंग टॉपिक्स होंगे, उनके अंदर जो गलतियां हो रही हैं, तो आप एक बार वो देखो, तो मेरे को लग रहा है आपका शायद वो चीज वीक है, और उसके लिए जो मैंने आपको बताया था आप एनालाइज करो और देखो फिर कि आप कहाँ कहाँ पर ऐसी गलतियां हो रही हैं आपसे, जीटीज के अंदर पीवाईक्यूज कर रहे हो जब उसके अंदर कहाँ पे ऐसी गलतियां हो रही हैं, और उसको फिर फ्लैश कार्ड के फॉर्म में या फिर वो पर्टिकुलर क्वेश्चन हाईलाइट करके रखो कि ये वाले तो मेरे को एक बार वापस देखने ही है कि भाई इस क्वेश्चन के अंदर ऐसी लैंग्वेज आ रही है तो मैं गलती कर रही हूँ, तो वो चीज आपको थोड़ा सा इन डेप्थ एनालिसिस करना पड़ेगा अभी।
या एंड रितिका, दिस इज फॉर एवरीवन आउट देयर जिसको लग रहा है कि ऐसी प्रॉब्लम हुई है, गो एंड एनालाइज योर क्वेश्चंस एंड मिस्टेक, एंड उसके बाद भी इफ यू नीड हेल्प वी आर ऑल देयर, अखिल इज देयर फॉर वन ऑन वन, फिर आप उसमें ऐसे बात करके यू कैन जस्ट शो हिम एंड देन ही विल एबल टू गाइड दैट व्हाट कुड बी द अनदर अप्रोच, ही इज open for one on one. Akhil, there are 2-3 questions. How many years of NEET PYQs are to be done for INI? Past कितने साल के questions?
NEET PYQs, I think you must have done, if you have prepared for NEET PG, then you must have done NEET PYQs, right? So at least for INI, if you are doing, ठीक है, जो भी आपने बुक मार्क करे थे NEET के PYQs, just do those things, है ना, एक तो, और दूसरा, if you have not done NEET PYQs, you are just preparing for INI for a long time, I think, which must not be the scene, then you can do 5 years PYQs of NEET, 3 to 5 years of PYQs of NEET. See, in NEET and INI, it's not the thing ki the things are different or anything. The NEET questions can be asked in INI also. There are very high chances, and INI questions are asked in NEET also. That's not the thing. So topics are similar. So you can solve as many years, जितने ज्यादा साल की करोगे ना, एम्स के भी और नीट के भी, जो मेरे टेलीग्राम चैनल पे हैं वो लगभग 8 to 10 years के हैं प्रीवियस, ठीक है, तो आप जितने ज्यादा प्रीवियस ईयर के क्वेश्चंस करोगे, आई थिंक दैट इज बेटर देन सॉल्विंग क्यू बैंक और एनीथिंग, ठीक है। तो if you have time, then you can go for first 3 years. Then if you have more time, then you can go for 5 years. But five
And
years,
if you have,
5 years you
and
should do.
yeah, if you have to choose one source for GT, which one you genuinely recommend?
One source, though, I will recommend definitely Marrow only, because there are, matlab, you will get the actual idea, because most all of the people give Marrow GTs, okay? So that ranking is genuine, and the paper is also, I will not say exactly same, but paper is quite similar, only pattern is similar, ठीक है, and GT का मैंने purpose बताया था क्या, time bound manner में खत्म करना है ना, so that practice is there. डेफिनेटली कोई भी प्लेटफॉर्म का जीटी तो ऐसा नहीं है जो कि एग्जाम के सिमिलर आ जाए या एकदम वैसा आ जाए, डेफिनेटली देयर विल बी डिस्क्रिपेंसीज, काफी चीजें अलग भी आएगी, जीटी में काफी रैंडम भी पूछा जाता है, बट आपको ये देखना टाइम बाउंड मैनर में कवर करना है, और दूसरी चीज है एनालिसिस अमंगस्ट ऑल दोज हु आर योर कॉम्पिटिटर्स, ठीक है, सो दैट विल बेस्ट, जो इन दोनों का कल्मिनेशन है, दैट विल बी मैरो ओनली, अदरवाइज यू कैन गिव डैम्स और बीटीआर जीटीज वंस और ट्वाइस, लाइक in a month you give 3 Marrow GTs, you can give 1 GT from other platform also, like that you can do.
Okay, Bhupendra, you can ask your question. There are 3-4 more questions we'll take because we are already ahead of half an hour. So just quickly, we'll quickly complete it.
Yeah, hello.
Yeah.
Yeah, hello.
Yes, you are audible. Please ask.
Yes.
Yeah.
Yes, I just want to ask about how to deal with physiology, like how to deal with graphs and how to tackle those multiple correct option questions.
How to deal with, what was the first question?
First question was how to deal with the subject physiology.
Physiology.
I find it, yeah.
Okay. So in physiology, see, in physiology, there are graphs, ठीक है, In BTR also, ma'am has made a separate video for graphs, particularly in physiology. ठीक है, जो भी ग्राफ्स है कार्डियक मतलब CVS के अंदर थोड़े ग्राफ्स हैं, रेस्पिरेटरी में थोड़े ग्राफ्स हैं, एंड क्वेश्चंस हैव बीन आस्क्ड. ठीक है, सो यू जस्ट गो टू द एम्स प्रीवियस ईयर क्वेश्चंस, है ना, एंड जस्ट सी दोज जो CO2 और ये रेस्पिरेशन और CVS इनके अंदर ही है ज्यादातर ग्राफ्स. ठीक है, तो इनके जो भी ग्राफ्स हैं, जो भी साइकिल है, जो भी चीजें हैं, ठीक है, वो देख लो कि PYQs में क्या क्या है, या फिर डायरेक्टली जो BTR में एक वीडियो है ग्राफ्स का, वो भी आप डायरेक्टली जाकर के देख सकते हो. सो उतना ही करना है, उससे ज्यादा नहीं करना है ग्राफ्स के अंदर. ठीक है, जो PYQs में आया है और वो वाले ग्राफ्स ही करने हैं, बिकॉज द सेम ग्राफ्स विल बी रिपीटेड इन अ ट्विस्टेड और मॉडिफाइड मैनर. ठीक है, ग्राफ्स विल टेस्ट योर कंसेप्ट, है ना, कोई ना कोई कंसेप्ट होगा विच इज ऑन विच द ग्राफ इज मेड, है ना, देयर इज अ कंसेप्ट ऑन विच द ग्राफ इज मेड. सो यू हैव टू स्टडी दैट कंसेप्ट. ठीक है, ग्राफ को एज इट इज रटना नहीं है, बट उस कंसेप्ट को समझना है, बिकॉज ग्राफ वो उसी सेम कंसेप्ट का अलग ग्राफ भी बना सकते हैं, एक्सेस चेंज कर सकते हैं, या फिर ग्राफ को मॉडिफाई कर सकते हैं. तो आपको उस कंसेप्ट को समझना है कि भाई बोहर्स का ऐसे होएगा, या फिर जो भी इफेक्ट्स होते हैं अपने रेस्पिरेशन में, इनके अंदर ये होगा, ये ब्रीदिंग के पैटर्न्स ये होते हैं. ठीक है, जो भी अपने वो वॉल्यूम वाला और वो सारा है, तो उसका आपको कंसेप्ट समझना पड़ेगा. ठीक है, एंड यू विल बी एबल टू डू दैट बेटर. और अगर समझ नहीं आ रहा है फिर भी कंसेप्ट, तो फिर यू कैन वॉच द वीडियोस के अंदर किसी भी फैकल्टी का वीडियो देख सकते हो आप. ठीक है, या फिर यूट्यूब पर भी उसका उस ग्राफ से पर्टिकुलरली देख सकते हो, या फिर मैरो के अंदर जो PYQs है उसके नीचे एक्सप्लेनेशन पढ़ सकते हो. तो वैसे आप कर सकते हो.
और सर वो मल्टीपल करेक्ट ऑप्शंस के बारे में,
मल्टीपल करेक्ट ऑप्शंस का मल्टीपल करेक्ट ऑप्शंस का क्या है, the more number of questions you solve na, there is elimination game in that. ठीक है, A is correct, A B is correct, A B C is correct, A B C D. अब now you know कि C and D are definitely wrong. ठीक है, अब आपको A और B में confusion है कि B सही भी लग रहा है और नहीं भी लग रहा, तो that will इसमें ना इंस्टिंक्ट भी बहुत ज्यादा काम करता है. उस दिन एग्जाम डे पर आपको क्या लग रहा है कि हाँ यार, कई बार लगता है कि एक तरह से सोचो तो सही लग रहा है, एक तरह से सोचो तो गलत लग रहा है, बिकॉज यू विल हैव डेफिसिट्स इन दैट. ठीक है, उसके अंदर आपकी नॉलेज कभी भी कंप्लीट नहीं होगी. यू विल बी एबल टू एलिमिनेट 2 ऑप्शंस विद योर नॉलेज, बट 2 ऑप्शंस यू विल गेट कंफ्यूज. ठीक है, आपको लगेगा कि यार मेरे नॉलेज के अकॉर्डिंग ये सही भी हो सकता है, और इसको ऐसे सोचो तो गलत भी हो सकता है. सो इन दैट थिंग, द मोर नंबर ऑफ क्वेश्चंस यू सॉल्व, the more instinct you will develop ki whether this is right or not. So that is the only thing that you can do. You cannot study the topics in so much detail that you are able to analyze all the 4 options in entire detail. ठीक है, ऐसा कम ही होगा. ठीक है, बिकॉज एग्जामिनर जो है उसने तो पूरा स्टैंडर्ड टेक्स्ट बुक से बनाया होता है क्वेश्चन, उतना तो पढ़ने का टाइम है नहीं, तो लास्ट में थोड़ा सा तुक्का वाला कह लो या एजुकेटेड गेस कह लो, वो थोड़ा सा अपने को करना पड़ेगा, और वो आएगा नंबर ऑफ क्वेश्चंस ज्यादा सॉल्व करने से.
And in the next question, there is one follow-up question that did you see gross image related stuff from STD books, standard books, right?
Nowadays, if you see any of the, like in pathology, you see Preeti ma'am's video or Zainab ma'am video or any other faculty video, or in any other radiology also you see all the images and all. So faculties are covering the images from the standard textbooks or the first image from the Google. ठीक है, बिकॉज एग्जाम के अंदर यही 2 चीजें आएगी, या तो स्टैंडर्ड टेक्स्ट बुक वाली फोटो आएगी, या फिर गूगल पे जो क्लासिकल इमेज होती है वो आएगी. एग्जाम के अंदर अनक्लासिकल इमेज आना बहुत ही ज्यादा लेस लाइकली है, बिकॉज सी सेम इमेज जो है उसके अंदर और क्या चीजें हैं, आप उधर एग्जामिनेशन तो कर नहीं सकते पेशेंट का. सो दे विल टेंड टू गिव क्लासिकल इमेजेस ओनली, है ना, वो हिस्ट्री में या तो कुछ ऐसा देंगे या फिर इमेज एकदम ऐसे क्लासिकल देंगे. सो यू हैव टू जस्ट सी द क्लासिकल इमेजेस. अगर आपको किसी इमेज में डाउट लग रहा है, जस्ट सर्च दैट ऑन गूगल, और ऊपर जो एक क्लासिकल इमेज लग रही है जस्ट सी दैट, बिकॉज वही आएगी. ठीक है, ज्यादा उसमें डिटेल में जाने की जरूरत नहीं है कि पूरा उसके बारे में और कहाँ कहाँ से देख रहे हो, क्या कर रहे हो. जो भी टीचर ने पढ़ाई इमेज वो ठीक है, और अगर कुछ लग रहा है कि और कुछ देखना है, जस्ट टाइप ऑन गूगल, और जो फर्स्ट 2-3 इमेज है बस वो देखनी है, दैट्स इट.
Okay, Rock Balbova, I don't know what your name is. Please
Hi,
ask
sorry.
the question.
Am I audible?
Yes, you are.
Yes, sorry. My name is Bharat, sir. Thank you so much.
Oh, hi, Bharat. Yeah.
Sir, actually, I'm an intern preparing for May 26 INICET, sir. I actually wanted to ask 2 small questions. First one is, many people are promoting first aid for first and second prof subject. What is your take on that? Do we have to follow that, since I have 1 year of time? And my second question is, sir, do you have any PDF of all the important PYTs for the 19 subjects? If yes, can you please have a link, sir?
So see, I'm not saying that first aid promoting first aid is good. That's why people are promoting it and people have cracked using first aid. Okay, so first aid is definitely good, no doubt about that, because it is based on USMLE pattern. And in USMLE first and second जो year के subjects हैं, जो step 1 होता है, उसके अंदर वो पूरा detail के अंदर आता है, and they have मतलब like authors who have made, they are definitely very brilliant only. They have summarized things in that manner. And nowadays if you see many of the people, they are using that thing also in teaching. Okay, even Zena ma'am is using and other faculties are using the first aid references for teaching, because that is standard, the information is correct, that is in a concise manner. Okay, the thing is, see, I also studied first aid a bit, but the point that was lacking na कि उसमें क्या था कि if the information is मतलब is cluttered, ठीक है, the information is very densely packed in that first aid, ठीक है, so इतना ज्यादा densely packed है कि उसके हर word से ना question बन जाता है, so you will not be able to analyze कि यार कौन सा word से क्या question बनेगा, कैसे बनेगा. But the same thing if you will study from faculty, ठीक है, same topic you will study from some faculty or who has solved some questions and then is teaching you, then you will have a better idea about that particular topic. ठीक है, क्योंकि आपने फर्स्ट एड से सपोज कोई टॉपिक पढ़ा, आपको वो आधा अधूरा समझ में आएगा. ठीक है, क्यों? क्योंकि आधा अधूरा से समझ में आएगा, वो अच्छा है, वो डेंसली पैक्ड है, बिकॉज उसमें सिर्फ कीवर्ड्स लिखे हैं, उसके अंदर जो एक्सप्लेनेशन पार्ट है और जो वो सारी चीजें, वो चीजें मिसिंग है. ठीक है, तो अगर आपका कंसेप्ट, आपने बुक्स पढ़ी है, वो पढ़ा है और आपके कंसेप्ट ठीक है, तो यू कैन डायरेक्टली गो फॉर फर्स्ट एड. ठीक है, इफ यू आर कंफर्टेबल कि हाँ मैं खुद से ही कर लूंगा तो ठीक है. बट फॉर मेजोरिटी ऑफ द पीपल व्हाट हैपेंस इज कि वो खुद से नहीं कर पाते. ठीक है, खुद से पढ़ना, उस पेज को पढ़ने में ही आप आधा घंटा लगा दोगे, इतना ज्यादा डेंसली पैक्ड है वो, है ना, और फिर उसके बाद आपको समझ नहीं आएगा इसमें क्या करूं क्या नहीं करूं. तो आपने सपोज एक फैकल्टी का वीडियो देख लिया आरआर का, या फिर कुछ आपने बीटीआर देख लिया, तो आपको आइडिया लग जाएगा कि हाँ यार इस टॉपिक से ये क्वेश्चन आते हैं. फिर आप फर्स्ट एड फिर आप पढ़ सकते हो, उसमें आप हाईलाइट कर सकते हो कि हाँ अच्छा ये चीज ऐसे है, ये चीज ऐसे है. बट डायरेक्टली सिर्फ फर्स्ट एड ही पढ़ना, वो थोड़ा सा मतलब मेरे को थोड़ा सा वो लगता है. पीपल आर रीडिंग एंड दे आर गेटिंग रिजल्ट्स, नो डाउट अबाउट दैट. सो इट डिपेंड्स ऑन द इंडिविजुअल पर्सन. अगर आपको खुद से करना और खुद से आपको लग रहा है कि हाँ मैं कर लूंगा और पीवाईक्यूज करके और फिर मैं समझ लूंगा, तो ठीक है. बट आई थिंक वॉचिंग अ वीडियो एंड देन स्टडिंग इज बेटर.
Perfect. Astra, you can ask your question. Okay, I think Astra is nowhere here. Maharshi, you can unmute and ask.
Yeah, hello sir. I wanted to ask, is there any basic difference in November and May INI? Because as you know, in last November INI, in which you topped, the first rank was something at 189 corrects, and the May INI, the rank was 165 correct. So is there any pattern difference or any weightage difference, or like because in Marrow the PYQs are year wise, like 2023 INI PYQs. So do we need to do November INI specifically with more aggression?
It varies a bit. Actually, the thing is that like in this NEET also, actually last NEET was more tough than this one. Okay, everyone will agree. But
Yes,
this
exactly.
this I am seeing that marks are a bit lesser than the last time. Okay, in May INI also that was easier than last time, but the marks were less. So
Yeah.
it varies from year to year also. Some year like I think last year थोड़े ज्यादा टॉपर ज्यादा अच्छे नंबर लाए होंगे,
Yeah.
और इस बार थोड़ा सा वेरिएशन आ गया, तो वो तो जो पीपल अपीयर कर रहे हैं एग्जाम के लिए उस पर भी डिपेंड करता है. और ये सब चीजें तो आप बोल नहीं सकते इस नवंबर के अंदर वो और ज्यादा पढ़ लेंगे, क्या रैंक आएगा, कितना स्कोर आएगा, ये सब तो एकदम इमटेरियल है.
मतलब like any क्वेश्चन पैटर्न डिफरेंस ऐसा कुछ नहीं है ना,
नहीं, मार्क्स आपको मार्क्स से कुछ करना ही नहीं ना. आपको तो सपोज इसमें INI के अंदर 165 टॉपर के हैं, ठीक है, और आपके 160 आते हैं, तो यू विल बी इन टॉप 10. ठीक है, बट नवंबर INI के अंदर अगर 185 आते हैं टॉपर के और आपके 160 आते हैं, तो आपकी रैंक फिर कहाँ जाएगी, 2-3 हजार जाएगी. ठीक है, तो ये वाली चीजें तो एकदम वो एग्जाम पे डिपेंड करेगी, आपके पीयर्स पे डिपेंड करेगी, उन्होंने कैसा परफॉर्म किया है. ये तो मतलब
दोनों एग्जाम में सिर्फ स्कोर डिफर करता है या फिर क्वेश्चंस का पैटर्न?
या वही आई एम सेइंग कि कोई क्वेश्चन पैटर्न का कोई मेजर डिफरेंस?
अच्छा, नहीं, एक्चुअली क्वेश्चन पैटर्न ये है कि आई थिंक कि मे वाला जो होता है उसके अंदर थोड़ा ये मल्टीपल करेक्ट क्वेश्चंस हो गए. ठीक है, और थोड़े से और थोड़े से जो थोड़े डीपर अंडरस्टैंडिंग वाले क्वेश्चंस होते हैं वो थोड़े से ज्यादा पूछे जाते हैं. जबकि जो नवंबर आईएनआई होता है वो थोड़ा सा फैक्चुअल बेस्ड ज्यादा होता है ना, और उसके अंदर जो कोर टॉपिक्स होते हैं और जो इमरजेंसी वाले टॉपिक्स होते हैं, जो बेसिक टॉपिक्स होते हैं, उसके अंदर वो आपको ट्रिक करके और कंफ्यूज करता है। जबकि मे आईएनआई अगर वैसे ओवरऑल देखें तो आई थिंक कि जनरली मे आईएनआई, बट वो फिर कभी चेंज भी हो जाता है, कभी नवंबर आईएनआई भी डिफिकल्ट आ जाता है, उसमें भी ज्यादा कंसेप्चुअल, तो ऐसा कुछ फिक्स नहीं है। बट इन जनरल नवंबर आईएनआई इज मोर फैक्चुअल देन मे आईएनआई and more one liners are there, ठीक है, in November INI, so that's how it goes.
Perfect. Astra,
Hello.
your question.
Yes,
Yeah.
ma'am. Actually, I'm starting my preparation after a gap, like after 2 years. So I will be relying on solely on the revision videos, and I'm thinking of adding, like I will just go through BTR, just see it once after completing a subject. So like as you know that INICET is very PYQ and PYT heavy. So I was thinking that I will read through the explanation of a particular PYT from the marrow, but I think I want to like know how can I like make it more like comprehensive, like about a different PYQ. Like my question is, how should one approach a PYQ? Like it, if it is given in a like a question stem, then we will get the topic. Then how should we like study it? Like should we
So
like
you are planning to study only from question, or you are planning to study the notes also?
like I will read the RR notes and I will like go through like I will read the RR notes, but I will go through once the BTR video as well to add the extra points, and I will go through the PYQs.
So see, if you have done BTR or marrow RR, you have to do only one thing, okay? Either do BTR of a subject or either do marrow RR
Like
of a.
I have a FOMO that are like RR videos enough like conceptually for the questions like that are asked in AIIMS.
No, the thing is that कि आप सिर्फ सिर्फ वीडियो देखकर और उसको देखकर ही नहीं जा रहे ना एग्जाम में. यू आर डूइंग फर्स्ट दैट वीडियो, ठीक है, वीडियो आपने करा, वीडियो विल फॉर्म अ बेस फॉर यू, ठीक है. दैट बेस फॉर्मिंग इज इंपॉर्टेंट. आपके पास जब कोर होगा ना, देन यू विल बी एबल टू बिल्ड स्ट्रॉन्गर, ठीक है. इफ यू डोंट हैव एनी कोर, देन यू विल नॉट बी एबल टू बिल्ड स्ट्रॉन्गर, ठीक है. सो आरआर और बीटीआर बोथ आर गुड कोर्स, ठीक है. दे आर नॉट बैड कोर्स, दे आर वेरी गुड कोर्स, ठीक है. Just the thing is that information is more densely packed in that, and you will not be able to retrieve the entirety of it in solving the questions, okay? Because that is in a short manner. But when you will solve multiple questions multiple times na, then you will realize the importance of those notes. Then you will see, acha ha, okay, these all things are there in notes, I just don't know how to apply, ठीक है. अब एक डिजीज के बारे में उसमें 4 ही चीजें होंगी, ऑप्शंस के अंदर 2-3 चीजें बाहर की भी होंगी, बट वो इन्फॉर्मेशन होगी उसमें जो कि आपको हेल्प करेगी एलिमिनेट करने में. बट इनिशियली वो आप नहीं कर पाओगे. जैसे जैसे आप नंबर ऑफ क्वेश्चन ज्यादा करोगे एंड यू विल रेट्रोस्पेक्टिवली सी योर नोट्स, यू विल रेट्रोस्पेक्टिवली हाईलाइट योर नोट्स ना, देन ओनली यू विल बी एबल टू अंडरस्टैंड द ब्यूटी एंड ऑफ दोस थिंग्स, ठीक है. तो मेरे हिसाब से आपको कुछ भी है, एक मैरो आरआर या बीटीआर कर लो, उसके बाद पीवाईक्यूज करो, बिकॉज वो करना ही सबसे जरूरी है. तभी आपको समझ में आएगा कि मेरे को प्रिपेयर कैसे करना है, मेरे को चीजें कैसे याद होगी, मेरे को चीजें कैसे याद रखनी है, मैं कैसे इन्फॉर्मेशन को एग्जाम डे पर रिकॉल कर पाऊंगी.
मतलब आई हैव जस्ट वन क्वेश्चन कि जैसे अगर मैं आरआर कर रही हूँ, मैं मेन नोट्स नहीं छू रही हूँ, तो फिर अगर कोई भी इम्पोर्टेंट टॉपिक है जो 3-4 बार रिपीट हो रहा है, उसे मल्टीपल बार क्वेश्चन आ रहे हैं, तो जो एक्सप्लेनेशन
तो
है क्या वो
पीवाईक्यू में आ गया ना, वो पीवाईक्यू में आ गया ना आपके.
वही पीवाईक्यू एक्सप्लेनेशन से कवर हो जाएगा? मतलब मुझे मेन
हाँ
नोट्स का फॉर्मो तो नहीं
हाँ
होना
हाँ
चाहिए?
हाँ. नहीं, पीवाईक्यू एक्सप्लेनेशन से कवर हो जाएगा. और सपोज पीवाईक्यू एक्सप्लेनेशन आपको इनएडिक्वेट लग रही है, समझ नहीं आ रही है, तो आपके पास अगर मेन वीडियोस का एक्सेस है, इफ यू हैव परचेज दैट, देन सिर्फ उस पर्टिकुलर टॉपिक को जाकर के देख लो. जैसे ईसीजी नहीं समझ में आ रहा है, तो सिर्फ वो वाला पर्टिकुलर टॉपिक देख लिया कि हाँ भाई ये वाली चीज देख लेती हूँ, बस उतना से बहुत पर्टिकुलर देखना अगर देखना भी है तो. अदरवाइज
जैसे मैं अभी
एक्सप्लेनेशन में
स्टार्ट कर रही हूँ तो
एक्सप्लेनेशन सफिशिएंट होता है.
Yeah, Astra, we'll take your questions one-on-one. May if that is, I think that one is enough. I have to give other people chance too. Hope you understand. Simran, you can unmute and ask.
Am I audible?
Yes.
Oh, thank you. Sir, actually, I want to ask 2-3 questions. Like, एक तो जब भी PYTs का मैं लिस्ट देखती हूँ ना, वो ऐसा लगता है घूम फिर करके पूरा का पूरा सब्जेक्ट ही बन गया. तो फिर उसमें डिफरेंस क्या है? लाइक जो कंटेंट है मेन वो उतना ही वापस आ गया PYT लिस्ट में मेरे पास. तो मैं प्रायोरिटाइज कैसे करूँ कि पहले क्या करना है? तो जो भी नंबर प्लेस अलॉट करती हूँ खत्म नहीं हो पाता.
सारे आएंगे, मैं क्या करूँ, टॉपिक सारे आएंगे, बट वो टॉपिक जैसे मैंने बताया था, सपोज पार्किंसंस का कोई क्वेश्चन आया, तो क्वेश्चन पीवाईक्यू में आएगा. सिर्फ एक सेकंड में चार्जर कनेक्ट करूँ, मैं स्विच ऑफ होगा.
So that this is a 1 hour session. It's going to be 1 hour 45 minutes. So I'll quickly wrap it up because I have to say.
हाँ, तो उसमें क्या है कि द थिंग इज कि एक सेकेंड, आप वापस रिपीट करना अपना क्वेश्चन।
सर कोई पीवाईटी लिस्ट से ना सब्जेक्ट का कंटेंट सेम ही आ जाता है जो है, तो सब्जेक्ट
हाँ,
टाइम पे
तो
पूरा ही
मैं
नहीं हो पा
वही
रहा,
कह
तो
रहा
उसमें
हूँ,
मैं कैसे
टॉपिक्स
प्रायोरिटाइज करूँ?
टॉपिक तो आपके इनफैक्ट मैं बताऊँ, आपके जो मेन नोट्स होंगे ना उसमें भी सारे टॉपिक्स कवर नहीं होंगे। पीवाईक्यूज में ऐसे ऐसे टॉपिक्स आएंगे जो मेन नोट्स में भी कवर नहीं है। बट द थिंग इज कि उस टॉपिक में से आपको कितना पता होना चाहिए, ठीक है। वो टॉपिक सपोज पार्किंसन का क्वेश्चन है, आपने मेन नोट से पढ़ा, मेन नोट्स में वो होगा 5-6 पन्नों का, 7 पन्नों का, ठीक है। वहीं रैपिड रिवीजन के अंदर वो होगा आधे पन्ने का, क्योंकि उसके अंदर बस उसका जो अपना जीन वगैरह है वो लिखा होगा, 2-3 पिल रोलिंग ट्रेमर्स और वो सब लिखा होगा जो प्रीवियसली आया हुआ है, और जो ड्रग आएगी वो लिखी होगी, बस सिर्फ काम काम की चीज लिखी होगी, ठीक है। और आप उतना ही याद कर पाओगे। या फिर जो क्वेश्चन के अंदर का अगर कुछ ट्रिकी उन्होंने पूछा घुमा फिरा कर, तो आप वो देख लो, क्योंकि आप उतना ही याद कर पाओगे। आप वो पूरा पूरा पार्किंसन तो अब जब आप रेजिडेंसी में जाओगे तब वो आप पूरा फिर डिटेल में पढ़ोगे, एग्जामिनेशन पे ये है वो है, जो कि मेन नोट्स में पूरा पूरा पढ़ाते हैं। तो दैट्स द डिफरेंस, ठीक है। जो आप डिफरेंस पूछ रहे हो ना मेन नोट्स और इसके अंदर, वो यही है। इनफैक्ट पीवाईक्यूज में बहुत सारे ऐसे टॉपिक्स आते हैं जो मेन नोट्स में भी कवर नहीं है, बट फिर उनके अंदर पता कितना कितना होना चाहिए उस टॉपिक के अंदर, दैट्स द थिंग। मैं ये नहीं कह रहा कि आपको टॉपिक्स, तो मैं कह ही रहा हूँ कि आपको सारे पीवाईक्यू सारे पीवाईटीज करने हैं, बट उसको कितना डेप्थ में करना है और क्या पर्टिकुलर कीवर्ड्स पे फोकस करना है, दैट इज द मेन गेम।
ओके। और तो जितने सब्जेक्ट्स होते जाते हैं ना, तो इतना बल्क एक्यूमुलेट हो जाता है कि उसको मैं रिटेन कैसे करूं? जब तक सेकंड साइकिल की बारी आती है वो पीछे के सब्जेक्ट ही उड़ जाते हैं,
इसलिए
तो
इसलिए मैंने
इसमें मैं
आपको कहा
कैसे
ना कि
रिटेन करूं?
इसलिए जरूरी है जो मैंने फ्लैश कार्ड बनाना बताया, और दूसरा 19 सब्जेक्ट के कस्टम मॉड्यूल बताया। बिकॉज आप वो करोगे, अब आपने फ्लैश कार्ड बना लिया, उसको आपने नेक्स्ट 2-3 डेज के लिए आपने वॉल पे पेस्ट करा, और 2-3 डेज के अंदर अब आपको लॉन्ग टर्म मेमोरी के अंदर चला जाएगा। जब आपने उसको 3 दिन तक दिन में 2-2 बार देख लिया, तो अपने आप लॉन्ग टर्म मेमोरी के अंदर चला जाएगा, ठीक है। तो यही एक तरीका है जिससे कि आप कनेक्टेड रह सकते हो 19 सब्जेक्ट से, ठीक है। बाकी तो कोई और वे नहीं है।
Thank you, sir.
Perfect. Lalita, your question. Then we'll pick Nitin, and there are 2 questions from the chat box. That's it. Lalita, 1 question for you.
Yeah. Thank you, sir. My May INI rank was 1,353, and I messed up my NEET so badly that I landed up in 11,000 rank. Right now, I'm actually aiming for MD medicine, sir. I'm so devastated, and it's actually taking me a lot of time to recover and start my now this November INI. Sir, the same thing like solving PYQs and the same thing will this really work for me? I don't know if I have made some mistake, with respect to the preparation or anything, but this is standard thing that everybody says, sir, do the PYQs and this and that. This is like something that everywhere in the YouTube or anywhere we see it, but I think only few people land up in the good score. So I think that extra, what is that extra thing that people do it like to get it up the outside thing out of the books?
आई थिंक कि देर इज नथिंग एक्स्ट्रा जैसा तो कुछ नहीं है, ठीक है। मैंने भी जो पढ़ा था, मैंने बीटीआर मतलब स्टार्टिंग में जो भी पढ़ा था कॉलेज के अंदर वो पढ़ा था, नोट्स बनाए थे तब कोचिंग के अंदर, ठीक है। उसके बाद फिर इंटर्नशिप के अंदर वही जैसे सब पढ़ते हैं वैसे ही पढ़ा था, ऐसा कुछ मैंने डिफरेंट नहीं किया था। इनफैक्ट अब मैंने अगर डिफरेंट किया होता तो मेरा भी हर एग्जाम के अंदर ही वही रैंक आया हुआ होता, बट दैट वाज नॉट द सीन ना। मेरा भी मे आया ना, फिर उसका नीट, फिर उसके बाद आया ना नवंबर, सो इट ग्रेजुअली इंक्रीज, ठीक है। तो ऐसा कुछ पर्टिकुलर नहीं है कि भाई सिर्फ यही बंदे का जिसका पीछे रैंक आया उसका भी तो आगे रैंक आ रहा है। तो इसका मतलब ये तो नहीं है कि सिर्फ उस बंदे को ही हक है रैंक लाने का, फिर सिर्फ उसकी ही आ पाएगी, नहीं, जिसकी पीछे आई है उसकी भी आगे आ रही है। तो उसमें ऐसा कुछ नहीं है कि डिफरेंटली, और आप जो कह रहे हो आपकी भी पहले एक बार मतलब मे आईना में ज्यादा अच्छी आई थी और नीट के अंदर पीछे आई, तो उसका कुछ ऐसे पर्टिकुलर, ये काफी मतलब ऐसे पर्टिकुलर इस चीज का एकदम एग्जैक्ट आंसर नहीं है। क्या पता मेरी भी नहीं आती, वो एग्जाम डे पर भी डिपेंड करता है, आपके फ्रेम ऑफ माइंड पर डिपेंड करता है। अगर आपने कंटेंट ठीक से करा है, कंटेंट वही है, अब आप खुद का नीट का पेपर आप एनालाइज करो और आप देखो कि आपके क्या क्या चीजें थी, क्या क्या टॉपिक जो आपने नोट्स में, डेफिनेटली मैं बता रहा हूँ आपके कम से कम 180 क्वेश्चंस तो ऐसे होंगे जो आपके नोट्स में और आपके पीवाईक्यूज में कवर्ड होंगे, ठीक है, नीट के अंदर भी। बट स्टिल आपका वो लैकिंग रहा। तो अब वो आपको देखना है कि यार मैंने एग्जाम डे पर रिकॉलिंग में मेरे से गलती हुई, या मैं एंग्शियस हो गई थी थोड़ा, या फिर मैंने ज्यादा सोच लिया था, या फिर वो हो गया था। तो बहुत सारे फैक्टर्स होते हैं। मेरे कुछ दोस्त थे जो इतना पढ़ते थे और इतना अच्छा भी कर रहे थे, बट एग्जाम डे के दिन नहीं हो पाया, तो फिर वही है कि इसकी कुछ वो तो नहीं है,
Yeah,
मतलब
yes, sir. Then how do we combine
Madhukar,
this
तो they
BTR and RR? This is one last question. Like, one, if we just stick on to one source, there will be a good visual memory, no matter what, whether we have read it. Like, even
या
sometimes the concept might not help, just the picture memory would help. But this combining BTR and RR becomes so tough that we can't read
Oh,
definitely both of them.
I never said to combine. I never said to combine. I never said to watch both. I always say कि watch one thing for a particular subject. ठीक है कि
Okay.
आपको बीटीआर किसी एक सब्जेक्ट का देखना तो सिर्फ बीटीआर देखो, आर देखना तो आर देखो। अब दूसरी चीज क्या करनी है, फिर पीवाईक्यूज करना है। पीवाईक्यूज में सपोज कुछ ऐसी चीजें आई आपने बीटीआर से करी, आपको समझ ही नहीं आई, समझ ही नहीं लगी कि क्या था क्या नहीं था, सिर्फ वो पर्टिकुलर टॉपिक जा करके फिर आप आरआर से देखो। ठीक है, बाकी कुछ नहीं देखना है, बाकी पूरा पूरा देखने आपको
Yeah, yeah.
लगेगा कि मैं पूरा ही देख लेती हूँ, वो कर लेती हूँ, पूरा ही देख लेते
Yes,
हैं,
sir.
बट फिर
Yes.
उससे आपके दो रिसोर्सेज बनते हैं। आप सिर्फ वो पर्टिकुलर टॉपिक जाकर देखो और उसमें जो आपके नोट्स में लैकिंग है, जो आपने प्राइमरी सोर्स यूज किया है, जो उसमें लैकिंग है, सिर्फ वो चीज उसमें ऐड करो। ठीक है,
Yes,
मैं
sir.
आपको मेरे भी नोट्स दिखाऊंगा तो उसके अंदर ऐसे ही है, कुछ कुछ
Yes, sir.
पार्ट बीटीआर का लगा और कुछ कुछ पार्ट मैंने जो जो फिर पीवाईक्यूज करे, जो मेरे को लैकिंग लगा वो फिर
Yes,
मैंने
sir.
आरआर से लगाया। तो ये चीज तो रहेगी, मतलब ऐसा कोई भी ऐसा तो नहीं है कि इसको करने के बाद आपको कुछ नहीं करना पड़ेगा, आपको पीवाईक्यूज भी करने पड़ेंगे। दूसरे सोर्स अगर समझ नहीं आ रहा एक्सप्लेनेशन से तो दूसरा सोर्स भी यूज करना पड़ेगा। ऑल दोस थिंग्स यू हैव टू डू।
Yes, sir. Thank you, sir. Thank you so much, sir.
Nathan, your question.
Hello, sir. I am 2018 batch, and after 1 year repeating in this May INICET, I got a 1.9K rank, and in NEET.
Hello.
Nathan, we lost you. Your voice. Okay. Meanwhile, he's not. His voice is not audible. There's one question that how to approach medicine, because a lot of them are facing problem with medicine.
I think
And
medicine, if you
Like,
have BTR,
hello.
then you can approach
yeah,
that
yeah,
in.
Nathan, you're audible now. Finish it.
Okay, Anna. Sir, I'm 2018 batch, and so after 1 year repeating, and in this INICET, I got 1900 rank, and in NEET PG, I got 3800. So I was planning for general medicine, but I'm from Kerala, so within my state, I won't be getting a seat, and in a nearby state, I may get in the later rounds of counseling. So I'm planning to do INICET seriously only. So I have done with my major subjects, main nodes, question bank and all. So like doing PYQ along with main subjects nodes of major subjects will be fine. And short subjects, can I go for revision videos and RR notes?
या बेस्ट सी यू हैव ऑलरेडी गॉट अ गुड रैंक। ठीक है, तो जिनकी ऑलरेडी अच्छी रैंक, वो the people who have got decent rank by preparing whatever you have used earlier, ठीक है, that means you are using the right resources, you have followed the right things, ठीक है, you don't need to change anything or do anything, you just need to add layers to it, ठीक है। Now you need to solve more of INI PYQs, ठीक है, you need to see if you have, like you are saying कि if you are finding कि short notes के notes are more bulky, ठीक है, they are becoming very bulky, short notes को revise करने में भी it is taking 3 days, then you can definitely switch to BTR or RR in that. But if you have some highlighted part or annotated part in your notes that you already have, then it becomes very easier to revise those. Okay. Like I said, I had my anatomy, I had my pathology, microbiology main notes only.
Actually, I am weak in anat, physio, like those subjects. So can I go
So
for
you
main
just have
notes
to see
along
ki
with
whether
PYQs?
you are satisfied with the notes you have, whether you have annotated them, whether you remember them or not. And if it is like I don't remember anything from that and it is completely new to me, then you can definitely switch to RR or BTR. Otherwise, you can go with your notes.
Those major subjects, actually I have written down separately the mistakes part, the tough topics, the volatile facts, everything I have noted down separately, so that will be also a good right to revise it.
So major
Okay,
topics
thank you.
like that, then you can do major topics like that, and minor subjects you can just see the RR or BTR. I think you should go, if you have BTR, then you can simply watch short subjects from BTR. That is more than sufficient.
Okay, perfect.
Okay,
So
thank you, sir. Thank you for your
actually,
response.
on the question of medicine, the problem is that how they should approach medicine, because marrow seems too difficult and vast. So should they go for RR or BTR or integrated system approach? Like how should they look into it?
I think the best thing, if you have not done anything, then best thing will be do integrated BTR only for medicine. Okay. And if you have done anything from the medicine earlier, then stick with that, because integrated medicine is also very vast in BTR also. Okay. So if you have done pathology, pharmacology already separately and medicine also separately, then you don't need to change anything. Okay. You can stick with that, and whatever topics you are finding they are very long, if you have done main notes, then there will be very long, then you can go for integrated BTR. Otherwise, if you have done RR from like Paraplatter, Deepak sir, Marwa sir is there, or any other RR you have done from Bhatia, Tamim sir, or any other faculty like DAMS or else, they have also taught pretty well in medicine RR, and you have done the subject separately, physio, pharmac and all, then there is no need to switch to integrated. Otherwise, if you are feeling lost, if you have only main notes of medicine and you are feeling lost, then you can go for integrated BTR.
Okay, perfect. So what is the best way to prepare for image-based questions? Especially, how can I create a collection of important PYQ image so that I can revise them effectively on the day before exam? All about image-based question and revising image-based question.
So I think actually just solve the image based questions, ठीक है, in your AIIMS or NEET जो भी PYQ custom modules and just solve those, ठीक है. I don't think there is any benefit of having collection and all, because you will just have screenshots and you will don't have explanation, or you will waste a lot of time in collecting them and those things. Nowadays, teacher covers approximately all the images. Okay, so just open your notes, pathology notes or radiology notes, whatever notes you have. Just solve the PYQs. Just see whichever images are not there. Okay, so the images that are not covered in notes, you just annotate them separately. You can just take a page, separate page and screenshot and stick them at the end of your notes. Okay, no need to collect all the PYQ images and all, because teachers are covering PYQ images only nowadays in their notes. Okay, so no need to do all those things. Okay, only the images that are not covered, you can just add it, like in anatomy and pathology. I am telling you that some histopath images, some collagen images, all those things that were asked in PYQs, I just took a screenshot of them and just pasted them in the PDF of those notes at that point only, where the teacher's image was there and this was the PYQ image, so that I can correlate also. No need to make separately or anything, just club it with your notes.
Perfect. I think we have already covered almost all of them, and I have to put a hard stop now. Those who have their question left, Akhil is all available for one-on-one call, so you can book us a one-on-one session with him and just ask all your questions there. Coming back to one last thing, which HK Medico is asking, that how many GTs, what were your GT score and how many corrects you are having? So first of all, before Akhil will even address this, it doesn't matter that what was Akhil's score, because it's not going to add any value to your preparation that what was Akhil's score and how he has improved. It's all about that how Akhil have analyzed his GT and what approach Akhil have took to improve the score. That is only your concern. Should it be what was his score? Because this is your journey and your score can going to be different, and the approach you will take to improve your score, that is also going to differ. So don't compare and us FOMO mein nahi jana hai to anybody. Coming back to Akhil, that how did you manage the last big jump in the INI before exam? Like, it's all about your score.
So the thing is कि like मैम है, ठीक है, कि आपको किसी का स्कोर नहीं देखना. अभी मैं अगर किसी और का स्कोर देख रहा होता कि मेरे इतना स्कोर था और इस स्कोर पे तो इतना ही आता, तो मैं भी वही रहता. बट like I said, I just used to analyze कि हाँ, I am standing at this position and I need to improve this much. ठीक है, you have to have that thing in mind. Don't compare yourself to any other topper, to any of your friend, to any of the other person. Okay, it used to happen in my college also. People used to ask their GT scores and all. I used to keep away from that. Okay, because someone will tell his GT score is this and he's not getting this and he's not getting that and then that. So why to think about all that? Ki your friend is getting GT score is this. Why you are taking that as a final rank? Okay, don't take that. मैं बता रहा हूँ मेरे से अच्छे जीटी स्कोर्स थे कुछ लोगों के, बट फाइनल एग्जाम के अंदर नहीं आया, ठीक है। और ऐसा नहीं, उल्टा भी होता है, तो एनीथिंग कैन हैपन, ठीक है। तो आपको जीटी स्कोर पर अगर आपकी वो मेंटेलिटी रहेगी कि मेरा अगर इससे जीटी स्कोर अच्छा है तो मेरे इसके एग्जाम से भी अच्छी रैंक आ जाएगी, आप ये सब सोच के चलोगे, या मेरा जीटी स्कोर तो खराब है और मेरी तो खराब ही रैंक आएगी। तो अगर आपने अपने आप को पहले ही उस बबल के अंदर रख लिया, यू हैव केप्ट योरसेल्फ इन दैट बबल, देन स्कोप ऑफ इम्प्रूवमेंट, जो आपका आउटस्टैंडिंग पोटेंशियल है, जो आपका ट्रू पोटेंशियल है, वो कभी एक्सप्लोर हो ही नहीं पाएगा। इसलिए आपको सिर्फ और सिर्फ अपना ही स्कोर देखना है। मैं भी वही बता रहा हूँ, मेरा स्कोर ग्रेजुअली इंक्रीज करा था, ठीक है। नीट तक काफी ज्यादा ऐसे ग्रेजुअली धीरे 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 करके इंक्रीज करा था। पूरे इंटर्नशिप में मेरा स्कोर स्टक था 140 से 150 के बीच में, ठीक है। उसके बाद में जाकर जब इंटर्नशिप मेरी खत्म हुई, व्हेन आई एक्चुअली रिवाइज द थिंग्स, तब फिर वो धीरे धीरे बढ़ के 155, देन 160, देन 165, देन 170 तक गया था। तो इट हैपेंस, ठीक है, ये पूरा एक प्रोसेस है, तो वो आपको पता नहीं है, आपको जस्ट उसको फॉलो करना है, जो भी आएगा। और ऐसा जरूरी नहीं है, अब इनफैक्ट मेरे नीट से पहले जीटी स्कोर्स वर बेटर देन एज कम्पेयर टू आईएनआई, बिकॉज आईएनआई के लिए मतलब आई वाज प्रिपेयरिंग, बट इतना ज्यादा जितना सिंसियरिटी से मैंने नीट के लिए करा था, आई जस्ट हैड दैट थिंग इन माइंड कि नीट के लिए मैंने अच्छे से प्रिपेयर करा है, मेरे को उसका जितना आता है उतना ठीक है, और बाकी मैं थोड़ा थोड़ा एड ऑन करता रहूंगा जितना भी मेरे से हो पाएगा, ठीक है। तो उतना ही मैं सफिशिएंट ही करता था। नीट से मेरे स्कोर्स आईएनआई के वक्त जीटी में कम ही आ रहे थे, बट ऑन द फाइनल डे जो मेरी नीट की भी मेहनत थी, ठीक है, ऐसा नहीं होगा आपकी, आपने जो भी नीट के अंदर मेहनत करी आप सोचोगे वो वेस्ट हो गई या वो हो गया, जो कह रहे हैं कि हमारे पीछे रैंक आई अब तो कुछ हो नहीं सकता। योर एफर्ट्स विल नेवर गेट वेस्टेड, ठीक है। यू डोंट नो द डे द योर एफर्ट्स विल मैनिफेस्ट, ठीक है। सो इट्स दैट काइंड ऑफ थिंग, ठीक है। तो ये चीज होती है, तो आपको पता नहीं है कि वो फाइनल डे कब आएगा, वो आपके एफर्ट्स कब मैनिफेस्ट हो जाएंगे, ठीक है। पूरा एकदम गेम उल्टा लग रहा होता है, जो क्रिकेट के अंदर भी होता है, इंडिया साउथ अफ्रीका का मैच था वर्ल्ड कप पे, है ना, ऑल ऑफ यू नो, ठीक है। इट वाज डायरेक्टली सेमिंग कि साउथ अफ्रीका इज गोइंग टू विन, दे आर मच अहेड, ठीक है, 90% विन चांसेस है जो भी है, बट till the last moment you don't know, ठीक है, till the last ball you don't know. So whatever your GT score is, you are feeling कि मेरा तो बहुत पीछे, हम तो हार ही गए, जो भी है, but you don't have to मतलब आपको एफर्ट अपना लगाता रहना है हर एक बॉल पे, मतलब every day you have to put your effort, ठीक है। every day you have to put your effort, and then you don't know when it will culminate, and maybe it will culminate on the last day, ठीक है। so that is best. आपको अगर लग रहा है कि अभी मेरा अच्छा नहीं आ रहा, क्या पता वो इसलिए अच्छा नहीं आ रहा कि आखिरी दिन बहुत अच्छा आना हो, ठीक है। सो डोंट बी इन दैट थिंग, है ना, तो ये सोच के चलना है हमें।
And for sure. So up, I will close this up, and because it's already 2 hours of the session, I've always aware that the session is going to be stretched, but almost stretched by 100% that I was not aware of. But thank you so much, Akhil, for patiently listening and addressing each and every question, and just not shying away or not getting in a rush to answer any question. That is your that is your speciality, and the magic you carry, that very patiently answering everything. And
thank you so much, thank you all of you for attending the session, and I hope that I was able to add value to your journey, and definitely I will be adding value to your journey ahead also through my Telegram channel and all, through my Telegram and YouTube. So keep in touch and share whatever you have, okay, and all the best for your all your future endeavors, for the NEET result, for the NEET counseling, for INI, सबके लिए all the best, and hope we will meet soon. Okay, thank you and best wishes to all.
thank you to all of you, and all the best to all of you. Just go and start preparing, and if it's something is needed, Akhil is available on his Telegram, YouTube, and one-on-one session, so you can talk to him, okay? And I'm all here to ping and bother any point of time. So chalo, we will say bye to Akhil, and good night, Akhil. Bye everyone.
Good night all of you. Okay.